The next bill on the calendar for today is Senate File 4612. The clerk will report the bill.
Senate File Number 4612, an act relating to state government, modifying provisions relating to the Department of Health, Human Services, and Children, Youth, and Families.
Members, before the author explains the bill, we have an amendment at the desk to insert the House language into the Senate file. All those in favor of accept the clerk? That's right. The clerk will report the amendment.
Bierman moves to amend Senate File Number 4612, the third engrossment. The amendment is coded DEA 4466.
Any discussion on the DE? Seeing none, all those in favor, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. I recognize the author of the bill, Representative Bierman.
Thank you, Mr. Chair. I'd like to start out with a couple thank yous to, first and foremost, my co-chair, Chair Backer, and my vice chairs, Representative Nadeau, Representative Ryer, and of course, our CAs, Jack Dockendorf and Hannah Zimmerman, and the researchers, Joe Durheim and Matt Eichinger. And we must include our LAs as well, Sanab and Liam. Without all of them, the work of the committee would not have come out as well and as smoothly as it did. We had good conversations among us, cordial, divisive, but here we are with the bill and glad to be here. I'll just give a few comments about perspective here, and then I'll turn it over to my co-chair to have a few words, and then we would like to move to the amendments, please, Mr. Speaker. Members, I won't sugarcoat this. This bill does not meet the moment. The bill is less than modest in its proposals and does not yet address the key healthcare needs that this state and our people need and deserve. The bill is at this point mostly just in alignment with the Trump and Republican Medicaid cuts, changes, and restrictions of H.R. 1, which will set healthcare in this state and our country back for a decade if allowed to stand for that long. To be clear, H.R. 1 is injurious, wasteful, and misguided policy. And it is a Republican bill. This is the Republican national health policy. In our state and on your watch, with your votes. While it is bad, even disastrous, it is also here, and we as a state must align or face even more harmful consequences from this federal government, well practiced in retribution as health policy. This bill goes against the values of our caucus. Until this bill comes back, improved, votes will be hard to come by on this side of the aisle. Thank you, Mr. Speaker. I invite my co-chair for comments, and then we can move to amendments. Thank you.
I recognize the member from Traverse, Representative Backer.
Yeah, thank you, Mr. Speaker and members. And I agree with my co-chair, Bierman. What allows us to do the work here is our staff, and we have, in my opinion, some of our best staff in the country here. So thank you for all the help. Well, members, what this bill does, it's a focus bill. It focuses on the realities that we have to work with. It does protect $3.5 billion a year in federal penalties. Again, $3.5 billion, and by year 5, it could be even greater to $5 billion. Plus, it avoids penalties. Along with that, it does put in Medicaid work requirements. Work is good. Work is good for folks. It makes people more productive. It makes us better as a society when people have responsibility. This bill saves taxpayers money. $2 billion roughly the first year, I said $2 billion, I meant $2 million, folks, $2 million. And then the second year, $100 million. And it helps rural constituents with disability, kids with disability, physical therapists, in mortuary services. So we will have, I know, a robust discussion on this. And I do understand that we have several members who does not like this bill. I get it. And I acknowledge that. At the end of the day, we have to do the work that's put into us, and sometimes it's not easy. So members, thank you.
There's an amendment at the desk. The chief clerk will report the amendment.
Bierman moves to amend Senate File number 4612, the third engrossment, as amended. The amendment is coded A1.
I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. The A1 is a technical House research amendment, and I'd ask for your support.
There's an amendment to the amendment at the desk. The chief clerk will report the amendment to the amendment.
Scott moves to amend the Bierman amendment to Senate File number 4612, the third engrossment, as amended. The amendment to the amendment is coded A29.
I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker. And members, this amendment addresses, and I'm just, if you'll bear with me here for a second, I'm going to try to find the actual bill that it's being amended to. For some reason, I couldn't get it to come up on my computer. I got some strange screen telling me I couldn't get there. But members, what this does is it addresses the section of the bill that has to do with the all-payer claims database. And members, this is a section of the bill that's expanding what the data with the all-payer claims database is going to be doing. In fact, they're going to be selling some of this data. And it never came to judiciary. I feel like this is something that deals with so much data, health data, that this is something that should have come to judiciary. But I'm wondering if the bill's author would yield for a couple of questions about the all-payer claims database.
He will yield, Representative Scott.
Thank you, Mr. Speaker. And Chair Bierman, thank you for yielding. One of my concerns that I have with this data is that it can be sold, and that's why I'm having this amendment, is to take it away, to take away that provision. But if this provision doesn't pass, can this data be sold to outside of the United States?
Representative Bierman.
Thank you, Mr. Chair. Representative Scott, I think it might be helpful for the body to hear from Representative Elkins, who's the author and knows this information inside and out. And if, with your permission, I would ask Representative Elkins to yield and take questions on this data bill.
Representative Scott.
Thank you, Mr. Speaker. And yes, that would be fine if Representative Elkins would yield.
Representative Elkins, will you yield? He will yield, Representative Scott.
Representative Elkins, could this all-payer claims data-based information be sold outside the United States?
Representative Elkins.
Thank you, Mr. Speaker. The uses of the data and the users of the data are specified in Chapter 62U of state law. The data is only accessible to researchers. I can actually probably read the actual section here, actually. It says data on providers collected under the subdivision are private data on individuals or non-public data as defined in 1302. So, and the data must be de-identified, and the commissioner's designee shall not publish analysis or that identify or potentially identify individuals. So I do not believe that that's the case at all. Further, I mean, the language in question here is actually a requirement in current state law in the same chapter. It states that the commissioner is required to develop a fee schedule to support the cost of expanded access and use of the data, provided the fees charged under the schedule do not create a barrier to access or use for those most affected by the disparities. So the provision in question here is actually something that the Department of Health developed in requirement to existing state law. And that's all it is. Oh, and yes, I request a roll call on this on this amendment.
Representative Elkins, in his yielding, requests a roll call. There are 15 hands. There will be a roll call. Representative Scott.
Thank you, Mr. Speaker. And Representative Elkins, you and I have had a couple conversations on this, but that language doesn't give me any comfort. There's nothing in that language that says whether or not this data can be sold outside of the United States. So China could, any other country, researchers from any other country could get a hold of this data if they paid the fee. And members, there are other issues with this, and I know what the underlying language is. It was passed a couple of years ago during the Democrat trifecta, greatly expanding the use of this data, and I understand that it's valuable data in this healthcare world, but of course one of my concerns always is that it can be re-identified, and there are some sections of this that allow zip codes okay, this is the medical claims of everybody in this room goes into this database, okay? And so even though it's supposedly de-identified, you can get a zip code. You know from looking at the claim what that person's illness is. And there are several other things that could really cause that information, especially say it's from someone that lives in a small town, to be re-identified. Members, I would encourage a green vote on this. I know it's kind of upsetting the apple cart here on this bill, but this kind of data, this kind of change in statute needs to come through the judiciary so we can have better looks at this stuff to make sure that it has some belts and suspenders so that it can't be sold outside of the United States, that the Department of Health has better parameters around how this data can be used and to whom into whose hands it can go. So I encourage a green vote. Thank you.
I recognize a member from Hennepin, Representative Elkins.
Thank you, Mr. Speaker. Yes, I think under Chapter 13, the Data Practices Act, I don't think you can sell data that's classified as private and non-public to overseas at all. But in any case, as Chair Scott mentions, she and I have been having ongoing conversations about this issue, and we will continue to. I'm sure this bill is going to be back and forth before it comes to passage, and she and I and the Department of Health will continue to discuss this issue. Thank you.
Recognize a member from Traverse, Representative Backer.
Yeah, members, I would ask for a green vote. It does make the data more secure, and that's what Chair Scott's biggest concern is, so I would ask for a green vote. Thank you, members.
Any further discussion of the amendment? I recognize a member from Olmsted, Representative Liebling.
Yeah, thank you, Mr. Speaker and members. Well, just to be clear, I would ask members to vote no on this amendment to the amendment. And I did not think that this measure needed to come to judiciary. It's really not changing the use of data. And the data is, just to be very clear, the data is not being sold. It is not being sold. And the alternative to having the fee structure is to have it paid for by taxpayers. So this is a user pays kind of thing. It is not selling data. And my understanding is it's allowing the Department of Health to very carefully determine which requests for data and which research projects are legitimate uses of the data. So this is not open season on data, and it's all de-identified. Thank you. So please vote no.
I recognize a member from Dakota, Representative Bierman.
Members, I recommend a no vote as well. Thank you.
Any further discussion? I recognize the author of the amendment to the amendment, the member from Anoka, Representative Scott.
Thank you, Mr. Speaker. Appreciate a green vote.
There being no further discussion on the amendment to the amendment, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Go ahead, Dave.
Baker votes aye.
Baker votes aye. McDonald. McDonald. Momani Hildsley.
Momani Hildsley, no.
Momani Hildsley votes no. Schultz.
Schultz, aye.
Schultz votes aye. McDonald.
McDonald, aye.
McDonald votes aye.
The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment to the amendment is not adopted. To the underlying amendment. Discussion. I recognize a member from Traverse, Representative Backer.
Members, on this one here, I would ask for a green vote. Thank you.
Any further discussion? I recognize the author of the amendment, the member from Dakota, Representative Bierman.
Members appreciate a yes vote.
Seeing no further discussion, all those in favor, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Hewitt moves to amend Senate File Number 4612, the third and gross one as amended, and the amendment is coded A3.
I recognize the member from Dakota, Representative Hewitt.
Thank you, Mr. Speaker. And members, I have to apologize. This is to fix a bill that I did last year. I don't want to get into graphics on it, as most of you have talked to me about this already, but basically it has to do with mortuary science and our new form of disposition, natural organic reduction. We had some flaws in the wait time. Through much work on this, we decided that we would extend the wait time, but only with the family being involved with that. Nora is growing throughout the country. We're seeing it grow more in rural areas. The farmers naturally want to return to their own land, so this is a really great option for them. But it's also important we try to keep this affordable, so this would be good for the whole state. Thank you, Mr. Speaker.
Further discussion. I recognize the member from Traverse, Representative Backer.
Vote green.
Any further discussion? All those in favor of the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Backer moves to amend Senate File Number 4612, the third and gross one as amended, and the amendment is coded A7.
I recognize the member from Traverse, Representative Backer.
Yeah, members, what this amendment does, it still allows individuals to pick different health care programs or medical assistance. What it does do is, though, if they do not pick and the county provides medical assistance through their Karma program, they will automatically be enrolled into that medical assistance program. Why that is important is it does give stronger care for adults who are vulnerable. Along with that, it does reduce administrative complexity for individuals who have trouble going through that. And it also actually helps our hospitals, because as we know that if people are not enrolled in a fee-for-service or another program, this will automatically get them enrolled so they have health care coverage. That's what it does. Would ask for your green vote.
I recognize a member from Dakota, Representative Bierman.
Members, this is a good bill. We passed our committee, and it's a good bill for Karma, so please vote green.
Any further discussion to the amendment? Seeing none, all those in favor of the amendment, please signify by saying aye. Aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Smith moves to amend Senate File Number 4612, the third and gross one as amended. The amendment is coded A2.
I recognize the member from Olmsted, Representative Smith.
Thank you, Speaker. So this amendment will be establishing a therapeutic psilocybin program. Here in Minnesota, psilocybin has shown through a lot of wonderful research an incredible ability to help those who are struggling with a wide variety of mental health concerns, from depression to addiction recovery, as well as PTSD, especially in veterans or public safety officers, those who have experienced a traumatic event, as well as assault survivors. So a lot of really good things to do. This program is a very conservative, slow entrance into this new area of psychedelic medicine with a pilot program that no more than 1,000 Minnesotans over the first 3 years will be a part of. And we're very, very careful to make sure that the right people get this and that there's the right information being gathered. A physician has to recommend them to the program. They go through a health screening, and there are 3 separate sessions that take place through the course of the treatment. The first one, you don't even receive any treatment. You're talking through it. The third one, you actually receive it with someone in the room who is licensed. And in that third and final time, you integrate your experience into the healing process. I think this is a really, really great program. I'm happy to answer questions on it on the floor, and thank you generally for the nature of this here. I really appreciate it.
I recognize the member from Chisago, Representative Reimer.
Thank you, Mr. Speaker and members. Thank you, Representative Smith. This has been a labor of love between him and I. It's been, yeah, it did sound a little bit weird. Sorry about that. I mean, listen, we could hug after this. I don't know. This is a really good pilot program, and it's buoyed by the fact that the Trump administration came out and said that there's a new openness to programs like this, and part of the bill instructs the department to go after potentially part of the $50 million that the Trump administration had said to kind of help fund and explore this program. So I want to just echo a lot of what Representative Smith said. It's a very careful entry into this. A lot of the testimony that was heard in both the Health Committee and the Veterans Committee, you saw some really good outcomes. And the way that I look at this amendment is it creates an off-ramp for people to not get hooked necessarily into drugs on an ongoing basis, but actually use a therapeutic like this to almost rewire their brain. The testimony that we heard firsthand from especially a lot of our veterans were that this was life-changing. So members, I think this might be one of, not the most consequential, but the second most consequential thing you vote on today, because I really view this amendment as something that is life-changing and life-saving, and I ask for a green vote. Thank you.
Further discussion, I recognize a member from Beltrami, Representative Bliss.
Thank you, Mr. Speaker. There's probably the first time you're ever going to, and probably the last time you'll ever hear me quote Shakespeare on this floor. But politics make strange bedfellows, and that I don't think I could have ever thought of signing on to a bill, like this. But in Minnesota, we lose 200 veterans a year to PTSD. That was a personal number for me a couple of years ago, January 1st, 2023. Yep, lost a family member that day. We lose 22 veterans a day nationally to PTSD. And it's funny, that number, I remember coming here and seeing 22 veterans' boots, or 22 pairs of boots on the front steps. I think that was 2017, my first year here, and that number hasn't changed, folks. We're not making any progress. Last year, we asked the MDVA to focus more on veteran suicide, and they've done a great job with the veterans' homelessness, and we're almost at functional zero there. We asked them to look more into veteran suicide. And for those of you who watched the movies or read the book Lone Survivor, I would recommend the book over the movie. Marcus Luttrell was a Navy SEAL his team was ambushed in Afghanistan. Long story, but he was a very, very traumatic experience. He went through this treatment similar to this. It's on President Trump's executive order. He listed off 3 or 4 different psychedelics, and ibogaine is the one that Marcus Luttrell got. And he stated that one treatment changed his life. One treatment. He was going through severe PTSD, and that there was a 2024 Stanford study on special operations veterans. They did this study, and and I'm quoting what the results were, dramatic, rapid, and sustained reduction of PTSD symptoms. There was also significant improvements in anxiety, depression, and cognitive function. 88% expressed reduction in symptoms after one treatment. 88%. 86% of the patients were still in remission from their PTSD symptoms 1 year after the first treatment. Members, if that was cancer treatment and a drug, we would have no questions on this. I think there's a little bit of hesitancy because of the magic mushroom stigma we're getting here. This is not legalizing mushrooms. I would be voting against that. This is a clinical trial funded through the federal government to help people with PTSD and severe depression. The PTSD, I've been doing some research since 2023. There's actually a physical change in your brain, the way that your brain functions, and they can measure it on brain scans and measuring the neural transmissions up there. And this treatment, in that study, they did neuroimaging, and it showed that the brain, the high beta activity that changes the brain for the PTSD in the soldiers was dramatically reduced. So a physical change. And I just want to end my statements. The lead researcher gave a statement. He said, "No other drug has ever been able to alleviate the functional neuropsychiatric symptoms of traumatic brain injury. The results are dramatic, and we intend to study this further." Members, this is important. We've got to do this. Please vote green. Thank you.
Further discussion. I recognize a member from Clay, Representative Keeler.
Thank you. I want to say thank you to Representative Smith for bringing this. I sat in the Health Committee when you brought this bill, and the testifiers that we had as the daughter and the granddaughter of a veteran, this is really solving a really big issue. I think it's important that we think outside of the box. I also just want to say I've been talking about this bill a lot in greater Minnesota and in rural Minnesota. And there's this stigma that sometimes we don't know what we can say or not say, or if people are going to like love it or hate it. And the truth is like everywhere I went and talked about it, people are really, really excited that we're doing this. People see this as a way to kind of move around some of the pre-authorizations that we have found utilizing other medications. And you're right, it's not like we're not adding mushrooms to a recreation. This is actual healthcare. This is mental health support, and this will save lives. And so I just wanted to say I'm really excited. I said that on the record before. I know Australia and Canada are really doing amazing things, and I think we can be a leader to do this. So thank you for the work you've done. Thank you for doing this in a really bipartisan way. I think we're doing some amazing work for our veterans. Wopida.
I recognize a member from Anoka, Representative West.
Thank you, Mr. Speaker, and thank you, Representative Smith, for bringing this amendment. It is a very good amendment, and most of the important bits have already been said, particularly what Representative Bliss brought up about the efficacy of PTSD treatment in relation to psychedelics. One thing I want to address is some might say, well, this seems really fast. You know, maybe we should not adopt it in this way. We should slow it down. One of the biggest reasons to do this today is the $50 billion available from the federal government. Many states are in no way ready to utilize that money. So by being early, we can have a program that will help many people with severe conditions, and we'll have it paid for by the federal government. That money is going to be spent. It might as well be spent benefiting Minnesotans. So I'd urge members to support this amendment, and I think it sends a very good message if you talk to a lot of veterans or really anybody who has had this experience in this space on how it's helped them. It's a unique intervention that fundamentally improves brain function and can address things unlike anything we've seen. And the evidence just keeps coming in. And like Representative Bliss said, we're seeing numbers, efficacy numbers, that are just unreal. It's incredible what's been advanced in just a few years. So thank you, Representative Smith, thank you, Representative Reimer, and Representative Bliss for moving this forward down the field. I think all members should feel very comfortable with a green vote on this bill, this amendment. So with that, Mr. Speaker, I would request a roll call.
All right, seeing 15 hands, there will be a roll call. I recognize the member from Anoka, Representative Scott.
Thank you, Mr. Speaker. Would the author of the amendment yield to a couple of questions?
He will yield. Representative Scott.
Thank you, Mr. Speaker. Representative Smith, thanks for the prior conversation, and a couple of other questions. Well, mostly one, why go through the Office of Cannabis Management versus the Department of Health? And what does the Office of Cannabis Management know about kind of instituting a study like this?
Representative Smith.
Thank you, Representative Scott. Thank you, Speaker. That's a great question. So, because we had these discussions, the initial version of this bill, if you go back to some of the other engrossments, did have the Department of Health much more involved. So, from a practical level, just to be frank, the Department of Health didn't feel that they had the expertise in this particular area to oversee this sort of program as we were designing it. And that's when the Office of Cannabis Management came in and started discussing it with us, much because, like cannabis, it is a naturally grown and occurred plant, right? Mushrooms can be grown from the ground. So they had experience in licensing things that were Schedule I from a federal perspective, but grown in state. So we stay away from the Interstate Commerce Clause, licensing those facilities, and then also licensing those who took the actual drug and actually administered it. So though this particular drug is very, very different in how it works in the body than cannabis and even what the treatment is, the actual steps of getting it to patients in a way that we thought was best, the Office of Cannabis Management, going back to when they were working in the medical cannabis area, felt that they had the expertise for this particular program.
Representative Scott.
Thank you, Mr. Speaker, and thank you for that answer. And so, just walk us through. I think I understand that this is overseen by a physician or a psychologist, psychiatrist. I know there are several steps to it, but I know that that person that undergoes this treatment is not in a room alone somewhere. Can you tell us what that might look like a little bit for the record? Thank you.
He will continue to yield. Representative Smith.
Thank you, Speaker, and thank you for that question. So we'll just go from the beginning. Someone feels that they're suffering from PTSD, and they hear us talking about it on the floor, and so when this goes into effect, they will go to their physician and mention this, or potentially a physician could recommend this to a patient they think has a qualifying medical condition, which will be defined in the rulemaking process. If this is something that the physician thinks is helpful to the patient and the patient wants to undergo, they will go through a health screening process to make sure there's no underlying health conditions that might conflict based on studies with the treatment itself. So just as an example, a history of psychosis would be something that most likely through the rulemaking process, we wouldn't want someone on this particular treatment. Once they pass that screener, they will then be referred to a licensed facility. In that licensed facility, they will undergo 3 separate sessions, and each of those sessions will take place with a licensed individual. We don't specify the particular program for the licensure of those candidates. However, we do recommend that the department, or I guess in this case the office, take into account already existing licensure processes in places that have them, which is mainly right now Colorado, New Mexico, and Oregon. So that those courses, those sort of things are already available. We're not building from scratch, so to speak. Getting back to the individual, they will have one basically administrative session where they will receive a full description of the treatment itself, what it's about, give informed consent to actually going forward on this. But then they will go home and they will be scheduled another time to come back to that licensed facility for the actual administration of the drug, or I'd say the treatment itself, for a full session. Again, they will always be in the room with someone who is licensed to guide them through that process. And that looks very different depending on the individual. There's some really interesting studies that you can find. And then after that, and that licensed individual believes that it is safe for them to go home, there's no more impairment because of the treatment, they will go home, and then they will come back for a third, what's called an integration session in the bill, in which they will talk about the experience, and that licensed individual will again try to connect the experience to the overall healing process, decide if it's something maybe that they should do again or to go back to the physician, whatever the recommendation might be from there. They're also licensed for just 1 year within the program. So if they want to renew, they will have to go back to the department to get a renewal.
Representative Scott.
Thank you, Mr. Speaker, and thank you, Representative Smith, for that explanation.
Further discussion. I recognize a member from Meeker, Representative Gilman.
Thank you, Mr. Speaker. I'm just curious if the author would yield for a question.
He will yield. Representative Gilman.
Wonderful. So I'm looking at Section 6. We had a nice conversation about location and facilitator locations. Again, it does mention private residences where we had a conversation about when patients would be not able to leave their home in order to have their treatment. So I was just wondering, as this moves through the process, would you be willing to define that more in statute so there'd be real clear guardrails around that? Again, grateful for this piece of legislation that's been brought forward. Just wondering if you've also modeled this around any other state in the nation that's already doing this.
Representative Smith.
Thank you, Speaker, and thank you, Representative Gilman. I really appreciate our conversations about this particularly, because the intent is certainly not that people will be taking this in their homes, certainly not by themselves. The reason we put this language into the bill is really an accessibility question, particularly in two fields that this drug has shown potential for. One is veterans. For example, if they are in a veterans facility that they don't want to leave or for some other reason want to have that there. And it will be an approved private residence. I think that's a key wording there. They're approved. It will have to be approved by the Office of Cannabis Management based on rulemaking, as you mentioned, that we will probably take from places like, again, the three kind of at the forefront, now four if we pass this today, will be Oregon, Colorado, and New Mexico. But certainly through the rulemaking process, we want to make sure that that is not the case. The other big group that would really benefit from this are those in our broader disabled community who may want a part of this but will not be able to either go for any particular reason to these sites that are licensed themselves. So that's why we put this language in here, and I absolutely will commit to making sure that your worries are not foregone.
Representative Gilman.
Thank you so much, Speaker, and thank you for your words on this. And again, I just want to personally thank Joe Rogan on the Minnesota House floor, that he had President Trump's ear and was willing to bring stories, again, of folks that have suffered and those that have died from PTSD and other traumatic brain injuries. This medicine, natural medicine, does create new neural pathways and a new opportunity for families across the state of Minnesota to help with healing. And I am grateful that this has come forward. I'll be excited to see how the finished product will look here. Yeah, excited that we will have an opportunity to capture, millions of dollars to help in helping families heal across the state of Minnesota. Thank you.
Any further discussion to the amendment? I recognize the member from Dakota, Representative Bierman.
Yeah, I just wanted to weigh in as well. I've heard a lot about this. We had the committee hearing, of course, so it's gone through a committee. Appreciate all the good conversation members have had. I've met a few people who have tried this, and the word they use is transformational. So I think there's a lot of promise in it, and I encourage a yes vote.
I recognize the author of the amendment, the member from Olmsted, Representative Smith.
Thank you, Speaker. I do have a thank you section. I didn't have Joe Rogan on there, but might as well say thank you to Joe Rogan as well. If you want to have me on the podcast, feel free. But in actuality, I do want to say thank you to a lot of partners in this room that have helped across the partisan divide on this. Going back to 2023, where we we're careful as a state and responsible. We had a task force. Representative West served on that with me, representing the House. Representative Hudson was on that bill with me. I think Representative Inget as well. So it has been great to work in this space. Representative Reimer, thank you especially for pushing these last couple of weeks. And if you were in the Health Committee or in the Veterans Committee, you got to hear some of these amazing stories. And I would recommend, if you weren't able to, if you don't serve on those committees or haven't seen the videos, to go back and watch them. We are doing something really incredible today. There are 1,000 Minnesotans right now who feel lost, who feel like potentially that their life is over, that they can't function. And probably not all 1,000 will find this drug helpful, but a lot of them will. And it will lead them to a better life than they thought is possible right now as we are voting on this bill. So thank you all. That is what this bill is about, and I really appreciate the support today.
Seeing no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Go ahead, Dave.
Baker votes aye.
Baker votes aye. McDonald.
McDonald, aye.
McDonald votes aye. Momani Hiltzley.
Momani Hiltzley, aye.
Momani Hiltzley votes aye. Schultz.
Schultz, aye.
Schultz votes aye.
The clerk will close the roll. There being 114 yeas and 15 nays, the motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Davis moves to amend Senate File Number 4612. The third engrossment as amended. The amendment is coded A17.
I recognize the member from Crow Wing, Representative Davis.
Thank you, Mr. Speaker and members. It is an honor to offer the A17 amendment that puts us in compliance with federal legislation because it actually does it in a clean, responsible way. It's no secret I don't like multi-subject omnibus bills. This amendment keeps the health bill clean by striking Article 1, Article 2, and Article 7. And I'm not necessarily opposed to taking those up on this House floor, but they should not be in this bill. It removes the provisions that should be coming here as single subject bills. Many Minnesotans are tired of us taking up bills like this. I'm even right now thinking of a Democrat in my district who always brings up to me, you guys need to be taking up single subject bills. We actually have time to do this the right way, the way the writers of our Constitution intended. And this restores single subject focus, improves transparency, and exercises fiscal discipline, which this body desperately needs. I also think Minnesotans are kind of getting tired of us leveraging these bills one side versus the other. And here we have an opportunity to be responsible and clean in the legislation that we're passing. Please support the A17 amendment. Again, it brings us in compliance with the federal government. And it also keeps in here the implementation of it at the state level. I ask for your support, members. Thank you.
I recognize the member from Dakota, Representative Bierman.
Thank you, Representative Davis, for the A17 amendment. Members, I would ask for a no vote on this. We have vetted all of these bills through committee. I appreciate the sentiment about having subject bills and hearing more of them. I think we've done a little bit of that in the last 2 years, last 3 years actually. So I'm glad to see that. It's something we are paying attention to. I think we can all admit when we have some single subject bills, we put them on the floor and we're doing more of that. It's hard with the volume of bills and the short time frame that we have up here to hear every single bill in that order. And so today I would recommend we vote vote no on this amendment and keep the bill intact. And ask for a roll call.
Seeing 15 hands, there will be a roll call. I recognize a member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And I rise to, of course, oppose the amendment and ask for a red vote. But I just want to supplement a little bit what Chair Bierman just spoke about. You know, what is a single subject? This is not a clear thing. What is a single subject? This led, when this state was founded, we didn't have word processing. Everything had to be written out by hand, and it was a different world. So I think we have to, and of course our government was more simple, and for some of you that might be a great thing. You might like to go back to that, I don't know, but we have more complex problems. We have more complex things we have to do. And this idea that every bill can come separately just isn't feasible. It's just not practical. We're not built for that. And so I would argue that this is a single subject bill, that when a bill comes from the Health Committee, it is a single subject. Now, if you take committees from, if you take bills from a bunch of committees and stick them together, you can argue that isn't. But this, I don't think there's really much of an argument. So I appreciate the opportunity to discuss this, but you know, any bill that's been on this floor, somebody could take it and say, oh wait, that's really two subjects. You could parse it out. There's just no definition in any that really prevails in all instances of what is a single subject. But from custom and usage in this body, and I think from common sense, a bill coming out of the Health Committee with things relating to health in it is a single subject bill. Thank you.
I recognize the member from Nobles, Representative Fogelman.
Thank you, Mr. Speaker. Thank you, members. I enthusiastically rise in support of this amendment. It's unfortunate to hear Representative Bierman ask for a no vote. This bill's main purpose is federal conformity, updating Minnesota's medical assistance program to match new federal Medicaid rules. Passing a clean conformity bill is critical. Without it, Minnesota risks losing billions in federal funding. The lost federal money would ultimately be passed to Minnesota taxpayers or result in deep cuts to our health care services. However, this omnibus also includes unrelated policy changes that have nothing to do with federal conformity. Those bills deserve to be standalone bills presented and voted on, just like a lot of the bills that we have already done just this week. The Davis Amendment strips out those extra provisions and keeps only the essential federal conformity language. Let's abide by the Constitution, let's do this right, and let's pass this amendment. Thank you.
I recognize the member from Traverse, Representative Backer.
Yeah, members, when this was brought up in front of the committee on March 4th, it did not prevail due to a tie. This is something that, I always refer to the federal government as the parents. And when they send all the money to Minnesota, 90% roughly, depending on what population you are, between 80 to 90%, they get to call the shots. So members, this is a good amendment. Would ask for your green vote. Thank you.
Recognize the member from Anoka, Representative Niska.
Thank you, Mr. Speaker and members. Thank you, Representative Davis, for this amendment. And, Representative Liebling, you make a somewhat fair point. What is a single subject? I don't think this underlying bill is unconstitutional within the meaning of the single subject clause, but it runs contrary to the purpose of the single subject rule, the single subject clause in our in our Constitution. What I can tell you violates the single subject rule is what now, 2 years after the fact, everyone agrees violates the single subject rule. What we saw on the last night of session 2 years ago, we now know that violates the single subject rule. There's some things that are being packaged up over in the other chamber and potentially being sent this direction that very clearly violate the single subject rule, and I hope this body doesn't take those up. We've made a lot of good strides this year with Republicans having a bigger role in this chamber than in the Democrat trifecta to make sure that we are doing the work in a transparent and open way, reaching the goals that our framers were trying to accomplish with the single subject rule. We don't need to tie one thing that one person supports with one thing someone else supports so voters don't know what we're voting for and what we're voting against. If we don't want Minnesota to lose billions of dollars in federal funding, then we should just all take up and support the provisions that would be left after this amendment. So this is a good amendment. I think I would support many of the other provisions if they were brought to the floor as single subject bills too, or more skinny bills, so that members of the public can see exactly what we're voting on and what we're not voting on. But this is a good amendment. It helps us further the goals of the Minnesota Constitution for the voters of Minnesota so they know what we're voting on so they can hold us accountable. Members, vote green.
Any further discussion to the amendment? I recognize the member from Dakota, Representative Roach.
Thank you, Mr. Speaker. I rise in support of this amendment. I appreciate Representative Davis bringing this amendment forward. You know, I've heard from many members the importance of this bill, and the reality is the major importance of this bill is the federal conformity. All the other stuff in here is just added on nonsense to get votes, which is frustrating. We should be doing the work for the people of Minnesota and having these votes and having these bills on their own, by themselves, not packaged together so we can trade a vote for here and a vote for that. You know, if we don't pass this conformity, Minnesota taxpayers are going to be on the hook. We're going to add $3.5 to $5 billion on the budget. And we got Democrats on the other side of the aisle that are in spite Donald Trump so much that they're willing to do that. That they're willing to put that on the backs of Minnesotans, and therefore they got to have their pork in the bill too. And I wish Minnesotans would see it for what it is. We need to stop this multiple bill. I'm gonna call it an omnibus bill. It's an omnibus bill. It's got many, many provisions in it. And we got to stop this practice. You know, part of the reason why we have such political division, in my opinion, is because of the omnibus bills. Let's work together on single bills, make amendments, and start representing the people of Minnesota and compromise. This, to me, isn't real compromise. It's 70 pages. Camouflage is compromised, so Minnesotans don't suffer the consequences of $3.5 to $5 billion more on their backs if we don't conform. So I appreciate the amendment, and I'm going to support the amendment.
Any further discussion to the amendment? I recognize the author of the amendment, the member from Crow Wing, Representative Davis.
Well, thank you, members. Thank you, Mr. Speaker. Representative Liebling, Representative Bierman, I appreciate your perspective. And Representative Liebling, you are correct. It's kind of up for interpretation. And that's my argument. Like, that's the problem I have with this, because my interpretation is we can't keep doing business as usual, and we need to operate differently in this chamber. And I think that now that we've got a tie in the House, we've seen improvements with this. We have. We've seen single subject bills come to this floor many times for votes. And so we're doing a better job now And then we send it over to the Senate, and the Senate Democrats stick them all back in a big bill and bring them back over here. We need to operate differently, and this would be a good start. So please support the A17. Let's show Minnesota that we can pass good bills and still do things differently. And I ask for your green vote. Thank you.
Seeing no further discussion, the clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Baker.
Baker votes aye.
Baker votes aye. McDonald.
McDonald, aye.
McDonald votes aye. Momani Hiltzley.
Momani Hiltzley, no.
Momani Hiltzley votes no. Schultz.
Schultz, aye.
Schultz votes aye.
The clerk will close the roll. There being 66 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Mahamud moves to amend Senate File Number 4612, the third engrossment as amended. The amendment is coded A14.
I recognize a member from Hennepin, Representative Mahamud.
Thank you, Speaker. And members, I put forth this amendment today to protect our hospitals, clinics, and patients from the harmful impact of H.R. 1, a bill that strips health care from vulnerable Minnesotans. At a time when hospitals across our state are operating on razor-thin margins, this bill would deepen an already dangerous financial crisis. Right now, 7 hospitals throughout the state of Minnesota that serve low-income and uninsured patients are facing the possibility of shutting down, reducing services, and eliminating vital positions. The HR alignment portion of this bill would further destabilize our healthcare system by reducing retroactive Medicaid coverage from 3 months down to 2 months or 1 month, depending on eligibility. What does this mean in real life? It means an uninsured Minnesotan who suffers a catastrophic injuries from a car accident would wake up not only fighting physically for their life, but also racing against a clock to get paperwork done. It means families facing trauma will be burdened with crushing medical debt. It means hospitals and clinics that provide life-saving care will go unpaid for services they provide. It means more uncompensated care, more financial strain, more staff cuts, and more threats of closures of hospitals that are hanging on by a thread. This is not hypothetical. This will happen. In 2024 alone, Minnesota hospitals reported $250 million in charity care, and that doesn't even account for all of the uncompensated care. We cannot continue asking hospitals to absorb more losses while expecting them to keep emergency rooms open and continue serving patients who walk through their doors. We should be making it easier for Minnesotans to access care, not harder. We should be protecting hospitals that serve low-income and uninsured patients, not pushing them closer to closure. We should be ensuring providers are reimbursed for the care they deliver, not facing them to absorb even greater financial losses. And we should preserve retroactive coverage protections that give patients a peace of mind during the most traumatic times of their lives. This amendment would do exactly that. Please support the amendment. I request a roll call.
Seeing 15 hands, there will be a roll call. Discussion to the amendment. I recognize a member from Traverse, Representative Backer.
Thank you, members, and thank you for the amendment. I'm going to ask for a red vote on this. And the challenge that we face with this is, first of all, the amendment reduces the cost sharing that is currently associated with this bill, which could risk future funding. And we know we have a very delicate system. Number 2, it asks taxpayers to fund additional months in the long term. And that's because anything beyond our half month that we currently have in this bill would be 100% covered by the state. And without federal match, that means we're paying more money. So this would put an additional burden on taxpayers. And then, of course, there's this risk. Number 3 is that it would risk our conformity status with H.R. 1 because keeping the coverage at 3 months instead of 1 month would also be a thing that would not serve our taxpayers well. So with that, I would ask for a red vote. I do appreciate the amendment, there's work to be done, and I acknowledge that. But for right now, this would not be, in my opinion, the right direction, so I ask for a red vote. Thank you, members.
Any further discussion to the amendment? I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Chair. I think the crux of the matter here is what happens to patients who are put into the hospitals among the 140,000 who have lost their insurance or deemed ineligible because of work requirements, which we're going to talk about in a little bit. What happens to them? Do they just get better? They seek medical care in the emergency rooms in all of your hospitals. And I would ask you to speak to your hospitals about this issue. I've been talking to hospitals constantly about this and H.R. 1 and the impacts which we haven't even felt the full brunt because H.R. 1 gets worse and worse in the years going forward. And ultimately, uncompensated care gets paid for by all of us, the taxpayers. It is cheaper to treat people for conditions when they arise and pay providers when they provide treatment than it is to do like what we're doing now, talking to hospitals about uncompensated care pools. We need to think differently about this. And this 90 days would be, it's already in our forecast for this term. So we should consider this, and I would ask members to vote green.
Further discussion to the amendment. I recognize the author of the amendment, the member from Hennepin, Representative Mahmoud.
Yes, thank you, members. I do hope you will support this. This is about keeping our hospital systems as healthy as possible during this financial crisis that they are facing, and it's about protecting Minnesotans. Please vote green.
There being no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Baker votes no.
Baker votes no. McDonald.
Vote no.
McDonald.
McDonald, no.
McDonald votes no. Momani Hildsley.
Momani Hildsley, aye.
Momani Hildsley votes aye. Schultz.
Schultz, no.
Schultz votes no.
The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Lee X moves to amend Senate File number 4612, the third engrossment as amended. The amendment is coded A11.
I recognize a member from Hennepin, Representative Lee X.
Thank you, Mr. Speaker. I also request a roll call vote.
Seeing 15 hands, there will be a roll call. Representative Lee.
Thank you. Members, I rise because the big, horrible bill is affecting all of our hospitals, healthcare programs, and we all know it. this president and his administration is putting the pressure onto states, our counties, and our providers. Even last month, he said it's, quote, not possible for the federal government to fund Medicare, Medicaid, and daycare because the U.S. is fighting wars. He wants American priorities to be military action over social programs, and his 2027 budget reflects that. He's going to cut even more money from healthcare programs and other social programs to give to the Department of Defense. With that, more Minnesotans are going to be uninsured, especially low income, rural, those with chronic conditions. There's going to be higher premiums, more out-of-pocket costs, more fees and pressure on marketplace enrollees, and countless other problems that are coming down the pipeline with H.R. 1. This is on top of the financial pressures that Minnesotans have to deal with right now. Rising gas prices, which are affecting their pocketbooks. And it's only going to get worse because all the tariffs and the war in Iran is affecting the supply chain, and that's hitting right now. So all that is to say that we have an opportunity with this amendment to do the least amount of harm. Cost sharing is not needed until 2028, October 1st, 2028. And we don't even have clear guidance in terms of how much it should be. Yes, Republicans will say, oh, financial funding or fiscal investment in people's health care or other reasons, but let's commit ourselves with this vote, with our green vote, to doing the least amount of harm. This cost sharing, these cost sharing sections are not needed right now. And we don't even know how much it could be. Maybe it might be zero with all of the budget talks that are coming over the next couple years and other funding opportunities from the federal government. So it really is that simple. We don't need it right now. Let's get rid of it. And I urge a green vote. Thank you.
Further discussion to the amendment. I recognize a member from Traverse, Representative Backer.
Under the provision of H.R. 1, to do the cost sharing and to conform with it, we have to start in 2028. So we're just doing it now, putting in, and it's not just, we're putting in place because we're conforming to H.R. 1. It makes sense to do it now. We got to do it anyway. So I would ask for a red vote on this, a no vote. Thank you, members.
I recognize the member from Dakota, Representative Bierman.
Members, I would recommend a green vote. Cost sharing does not improve health outcomes. Cost sharing is something that has been studied, and we know that people forego coverage, conditions get worse, then they end up in the ER, and again, hits our hospitals and bed availability, and the chronic conditions get worse. So if you're looking for better public health, saving money in the long run, and helping our hospitals, this is a good amendment. So vote green.
Any further discussion to the amendment? I recognize the author of the amendment, the member from Hennepin, Representative Lee X.
Vote green, please. Thank you.
Seeing no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Go ahead, Dave.
Baker votes no.
Baker votes no. McDonald.
McDonald, no.
McDonald votes no. Momani Hiltsley.
Momani Hiltsley, no.
Momani Hiltsley votes no. Schultz.
Schultz.
Schultz, no. Momani Hiltsley, green.
One at a time here. Schultz.
Schultz, no.
Schultz votes no. Momani Hiltsley.
Go ahead. Momani Hiltsley, green, yes.
Momani Hiltsley changes from no to aye.
The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Liebling moves to amend Senate File 4612, the third engrossment as amended. The amendment is coded A10.
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, we need to really be clear about what the underlying bill is doing, what this conformity or whatever you want to call it is doing. I heard Chair Backer say before, the feds are the parents. They get to call the shots. I've heard that a few times from Chair Backer. You know what? There is something called state sovereignty. Ever heard of it? The feds are not our parents. I'm so sorry, they're not. We are a sovereign entity. Now, do the feds do things that we consider we have to comply with? Yes, because they do supply a lot of the money, and this is the way our system has become over the years, that there's a lot more federal preemption and all of that. And what we're dealing with today is a bill before us to fall into compliance with requirements from Republicans in Congress, and let's be very clear, what we're dealing with today, cutting our Medicaid program, hurting our hospitals, is all Republicans. This is a Republican-owned policy, and I know some of you love it. Some of you are really happy to be doing it, cutting Medicaid, saving public dollars so billionaires can have more tax cuts. I know that's a favorite of many of you. But what you are doing, just to be clear, what you are going to be doing when you vote for this bill is hurting your own constituents and possibly putting some of your own hospitals out of business. Because like it or not, a lot of the money that keeps them going is Medicaid money. And a lot of the hospitals, especially in the rural areas, that's where the higher populations of people are who are on public programs. They're not people in the cities, they're people, the higher percentages of Medicaid population is in the rural areas. And so, this bill before us, complying with the federal requirements, the hostage taking by Republicans in Congress, that's what it is. Hostage taking. You better do this or we will take away billions of dollars that you use to provide health care for your people. That's what we're dealing with today. So, what I'm trying to do with this amendment, what we're trying to do, the Democrats here are trying to do with this, is to reduce the harm. Reduce the harm. And I believe that we should be doing with this bill, we should be doing as little as we can get away with to comply, as late as we can, and only to the degree that we absolutely must comply with the hostage takers. Because this is hurting our people. And when you all go out on your campaigns this summer, I hope that you're honest about that when you talk to your people in your rural districts about health care. And they say, what are you doing for me? And you can say, well, I helped to cut Medicaid. Republicans have helped to cut Medicaid, and that's going to hurt your hospitals and your ability, even if you're not on Medicaid. If there's no hospital there, you got to drive hours. Who knows where you have to go? We've got a bad enough problem already without the feds coming in as our abusive parent in this case, I suppose, to tell us that we have to hurt our own people. It's really shameful. So this A10 amendment helps with a little bit of that. It helps to reduce the harm. So it's a real test. And by the way, I'd like a roll call, Mr. Speaker.
Seeing 15 hands, there will be a roll call. Representative Liebling.
So no getting away from this one. This is a test. This vote, and we have some other amendments. We've had a couple of amendments. These are tests about whether you're actually on the side of your own constituents who need this care and who need a hospital, even if they're not on public programs, or are you just happy to go along with the hostage taking that's going on here? So this amendment, the A10, does a few things. For one thing, it has the commissioner having county agencies report. This has to do with the work requirements that are going to hurt us so badly, that are actually, just because of the added bureaucracy, an added need for administrative help, a lot of people are going to be losing health care who actually need it and are currently eligible for it and are actually really needy. And this is going to be on you, Republicans. So the first piece has counties reaching out for help if they're unable to keep up on the applications and redeterminations. And then there's some changes here that attempt to let fewer people be kicked off Medicaid, that attempt to have, for example, somebody who's medically frail not have to meet the work requirement, somebody who's experiencing a short-term hardship not have to meet the work requirement, somebody who's a victim of domestic abuse not having to meet the requirement, somebody who has a child 21 years of age or younger with a disabling mental disorder not having to meet the work requirement, etc. And it goes on, and it has some other things about exemptions for folks, and these are all things that we can do and still be in compliance with the hostage takers. So I think this is a really important amendment, this one and the ones that you've already voted for or against in many cases here. But this is your opportunity to show that you care about these frail people in your district, that you're not just gleefully going to be kicking people off of their health care and having them show up at your hospital for uncompensated care. Because as has been mentioned here by some of my colleagues, people do still get sick if they don't have health insurance. And when they get sick, I don't think Minnesota's a place where we're going to let people just be sick and die in the street. I'm certainly not going to be for that. I will never vote for that, and I hope you won't either. So I hope you'll vote green on the A10 amendment. Thank you, Mr. Speaker.
Discussion to the amendment. I recognize the member from Traverse, Representative Backer.
Yes, members. You know, we have a federalism form of government. And really, if we look at what H.R. 1 does, is H.R. 1, we have a national government, but then we also have our states. And what this bill does, like we've seen so many other times with block grants and other type of programs, and I'm not saying this is similar to a block grant, but it really allows the states to do their own testing. At the end of the day, the federal government says you have to do A, B, C, or you don't get dollars, okay? And that's what I meant by parent. That's what I meant by that. I was a little bit taken out of content, but that's fine. That's okay. I've heard that before. But what I'm sharing is the state calls the shots because they send them the money. It's no different than having teenagers and parents. If you don't follow the parent's will, you don't get your allowance. So that's what I meant by that. I want to clarify that. And I don't disagree with the chair in regards with we want to help the people that are vulnerable. What we heard before on the bill before us that we passed the OIG is about fraud. The challenges of self-reporting that you're working doesn't make sense to my constituents, to a lot of Minnesotans, of that. We've had abuse of fraud. I can empathize that some of the individuals will have difficulty with this conforming, though we have such bad fraud in our state that opens it up by saying, whoa, hey, yeah, I'm working, but they're not working. We have to keep accountability. It is good for individuals to work. That is not a four-letter bad word. Work is good. Taking responsibility is good. And that is what we are doing. And there are guardrails. We'll get into it in the third reading and stuff like that, that it's not just work. There's other things that people can do to qualify for it. So that honor system hasn't worked here in Minnesota since, as Representative Franson talked about with child care for the last 7 years. I'm concerned that it will not continue because the past can give you a picture of the future. So I'm asking members to vote red, vote no.
Any further discussion? I recognize the member from Dakota, Representative Bierman.
Thank you, Chair Liebling, for the amendment. Got a few things to say on this one. Work requirements for Medicaid eligibility is a tried and failed policy. 93% of participants in Medicaid already work, meet the requirements, and about half of the remainder actually qualify for coverage, and the cost of the program redetermination every 6 months that states have to do, that counties have to do, all that effort, all the supposed realized savings and alleged savings revert to more uncompensated care for hospitals through emergency departments. And what are we going to accomplish? The Republican-led bill here in Minnesota, seeming the centerpiece of the national Republican health care policy, you know, Chair Backer commented about the savings in this bill. The costs of this bill, it's estimated $200 million in lost federal funding for Minnesota each year. Each year, due to fewer people having coverage, along with an estimated $165 million increase in administrative costs for the state, counties, and tribal entities. That's hitting all of us. In rural areas will be particularly affected. They will have more significant cuts to healthcare access, increased health insurance costs for farmers, reduced food assistance, and local administrative burden. This will affect your property taxes, your health insurance costs, your health care costs, and the distance you need to go to find health care services from already strained providers that are being constricted. This scheme, designed to have people fall off coverage, that's what this is. That's how the savings come about. People fall off coverage. Now they don't have health care. With the burdens of the continual churn of enrollment, lower income working people with multiple jobs and any type of health condition, they face challenges and obstacles many of us just fail to appreciate. And again, why are we doing this? Do we need to solve some national crisis and cut budgets? Do we need to put the money elsewhere? No, the scheme is to cut $1 trillion from our safety net system budget to provide the tax cuts, as was mentioned, for the wealthiest billionaires, and at the same time, drive up the national debt. Will be over $38 trillion. That's the Republican health care plan. accelerate the closure of more obstetrics in rural areas, and reduce clinical services. Member hospitals are going to close, and most likely the rural ones will go first. I just saw a Forbes article. It talks about the big beautiful bill and the eliminating of supplemental payments that small communities are going to feel more and more. Home provider networks are one of the things that hospitals currently, some have stopped already, but had been doing. They will not be able to continue. Between the workforce shortage and the travel distance clients make providing home care in rural areas exceedingly difficult to begin with. But I got some of this information from the National Rural Health Association. And they quote, small outstate communities tend to rely more on funding from programs like Medicaid that face deep cuts under H.R. 1. In towns like Wadena, federal and state dollars coming into these communities help keep hospitals open, people employed, care delivered. Let's see what happens when 1/5 of that funding is gone. A Forbes article looked at hospital closures that they project the big beautiful bill puts 400 hospitals at risk across the country. And they list 7 here in Minnesota. How many hospitals close in the end depends how heavily on how states implement work requirements, how broadly they define medically frail. They list, of course, Hennepin County Medical Center, which we're going to be dealing with, I hope. They list the Range Regional Health Centers in Hibbing, the Lakewood Health System in Staples, a Mayo Clinic in Albert Lea, which already cuts services, but they're saying the whole hospital is prone to fall. St. Gabriel's in Little Falls, Lake Health Center in Baudette, Mahnomen Health Center in Mahnomen, which also already doesn't have beds for overnight. It's an emergency care facility now. The big beautiful bill has impacts that are going to be affecting rural communities, and I have concerns because I've been contacting hospitals the last few weeks, and I've spoken to 7 other rural hospitals with major concerns. Some are on the ropes now. They have negative cash balances. They're unable to get loans even from their local banks. I can share those locations with you if you want to check with me to see if your location is on the list. The point is, H.R. 1 will push many over the edge for hospitals, and they're standing on that edge now. Thank you for the amendment, Chair Liebling. Vote yes.
Any further discussion to the amendment? I recognize the author of the amendment, the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker, and thank you, Chair Bierman, for that excellent discussion. And the only thing that I would say in following that is that the calling this a big, beautiful bill, wow, I mean, that is the biggest misnomer in the history. Well, maybe it was a bigger misnomer or a bigger lie to say that Trump won the election that he lost, but this is really a lie. This is a big, ugly bill, and what it's going to do to your constituents is extremely ugly, and you have a chance on this amendment to say that that's not what you're about. So vote green.
Seeing no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Go ahead, Dave.
Baker, no.
Baker votes no. McDonald.
Say it again.
McDonald, no.
McDonald votes no. Momani Hillsley.
Momani Hilsley, aye.
Momani Hilsley votes aye. Schultz.
Schultz, no.
Schultz votes no.
The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Liebling moves to amend Senate File Number 4612, the third engrossment as amended. The amendment is coded A13.
I recognize the author of the amendment, the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, this one is very clear for you, members. This is another one that's going to tell your constituents whether this big, ugly bill, the Republican health care plan, is what you want to bring to your constituency, or whether you're doing it kicking and screaming like the DFL is today. So this is an amendment that says we're only going to comply as long as we have to. So the argument I'm hear from the other side, Chair Becker, is, well, we have to do this. We have to, or we'll lose this money. Well, this amendment says the minute we don't have to, we don't. The minute the requirement is gone, we're not going to do it any longer. So this is really a measure of whether you actually are with your colleagues in Congress, all the Republicans in Congress, and President Trump in wanting to take health care away from Americans, or whether you're doing it kicking and screaming like we are, because it is a hostage taking, as I said before. So, so vote green on the amendment.
There is an amendment to the amendment at the desk. The chief clerk will report the amendment to the amendment.
Nadeau moves to amend the Liebling amendment to Senate File Number 4612, the third engrossment as amended. The amendment to the amendment is coded A35.
I recognize the member from Hennepin, Representative Nadeau.
Thank you, Mr. Speaker, and thank you, members. As simple as, and thank you, Representative Liebling. We heard this in committee, and I'm glad that you brought it so we could have another discussion. And so my amendment to the amendment, members, would literally just use the same trigger mechanism that Representative Liebling is putting in place, so that the minute the federal law changes, that that anyone employed to provide conformity at the state level their employment would be immediately terminated. And it's not meant to be mean-spirited. It's meant to talk about the consequences of what I consider the A13 to be. It's more of a, let's make a statement and let's talk about how bad the big, beautiful, ugly bill is. But there's consequences to states when we work in partnership with the federal government. And there's infrastructure that's going to be built. There's contracts that are going to be there's contracts that are going to be entered into. And so I think the A13 is short-sighted and wrong-sighted. If in fact we're going to do this, we should also take the next step and say that we no longer have to conform, and so therefore we no longer have to have employees that are working on conformity. And it kind of goes to, almost with what Representative Bierman was just talking about. And he was talking about all the impending things that are happening. But the one thing that's not happening in Minnesota is agencies aren't losing people. Agencies aren't losing funding. They're actually growing. They're growing faster than, almost anything over the past, from 2021 until now. They're growing faster than almost anything. So, members, all this amendment to the amendment does is tie the same trigger to any HR conformity employees. They would be terminated at the same exact time as Representative Liebling's bill goes into effect. Thank you, members. Vote yes on the amendment to the amendment.
I recognize a member from Dakota, Representative Bierman.
Thank you, Representative Nadeau. At least something's growing in our economy. I appreciate the amendment, and I see where you're going here. And at a certain level, it makes complete sense, and it's something I'd actually like to talk to you more about in conference, perhaps. But today, I'm going to say vote no on it because few things. First off, hiring people. When you do hire people, staff are entitled to have a proper notice, and the amendment requires immediate termination. And we don't know what the backlog looks like for this. We could have Representative Hicks speak to this, but I know there's a huge backlog that is constantly growing on redetermination, even with and eligibility, even with the year-long system we're on now. We jump into this next one where it's 6 months, that's going to grow exponentially, and so pulling them out immediately might have consequences. But the more significant concerns are still agencies like DHS. You know, sometimes employees do not work on single programs, they work on multiple ones, and they utilize numerous funding sources outside of a budget appropriation. And under this language, even if someone had 1 cent of $1 million over a year working on this program, they could be terminated. So we'd have to talk about figuring that language out in the future, but today, please vote no, and I request a roll call on this.
Seeing 15 hands, there will be a roll call. Any further discussion to the amendment? I recognize a member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Will Representative Nadeau yield to a question?
He will yield, Representative Pinto.
Representative Nadeau, I've noticed that many of the actions taken by the Trump administration have been blocked by courts. That sometimes happens for a short period of time. They get reinstated. They get put back in. We've seen a lot with tariffs, for example. How would things work under your bill if a provision is not in effect for some period of time, and otherwise your amendment kicks in? So the state employee, the employment is supported with appropriations in the act, et cetera. How would that work for if in fact, because the way I read this is the provision would not be in effect at that point?
Representative Nadeau.
And thank you, Mr. Speaker and Representative Pinto. I think you'd have to look at the underlying triggers in the underlying amendment. And that's so if you look on line 1.18, Commissioner would immediately suspend implementation. Line 1.10, federal law no longer requires states to impose work or community engagement requirements as a condition of receiving federal financial participation for the medical assistance program. So I didn't add any new triggers. I merely use the triggers that Representative Liebling is putting in place.
Representative Pinto.
Thank you, Mr. Speaker. I may need Representative Nadeau to yield again if he's willing.
He will yield. Representative Pinto.
Thank you. Representative Nadeau, I'm confused because I think you do have separate triggers. Your amendment doesn't reference the Liebling amendment at all. You're inserting it 17 pages separate from the Liebling amendment. There's no reference. You simply say, notwithstanding any law to the contrary. That does reference the Liebling amendment. It also references any other law that's ever been passed. And what you're saying is that if a provision enacted in the bill from last July that folks have referenced here, the big ugly bill, if that's not in effect for any reason, but you don't make a reference to the Liebling amendment at all. So I guess I don't see, can you point to where in your amendment the Liebling triggers are, or where the underlying amendment shows up?
Representative Nadeau.
Yeah, thank you, Mr. Speaker and Representative Pinto. So the notwithstanding any law, I would say number one, it specifically references Public Law 119-21, which is the H.R. 1. If it's repealed or otherwise no longer in effect for any reason other than reaching that federally required date, that's when this would go into place, in place. And so Representative Liebling is the bill is conditioned on H.R. 1, and so I think there's a direct nexus between those two.
Representative Pinto.
Thank you, Mr. Speaker. Yeah, Representative Nadeau, I'm not arguing that your amendment's not germane, and I agree with you that your amendment is referencing that if a provision in H.R. 1 is not in effect, then potentially somebody loses their job. So that gets back to my first question, and again, that has nothing to do with the Liebling amendment. My question back to you is, if it's not in effect because a judge says it's not in effect, and then later that gets overturned. How does that work? Because your thing says that if they're not in effect for any reason at all, we've just lost a state employees. Can you just clarify how that would work under that temporary circumstance?
You're asking him to continue to yield?
Mr. Speaker, I certainly am.
Representative Nadeau.
Thank you, Mr. Speaker and Representative Pinto. I would guess that if a judge overturned a decision, then the Public Law 119-21 would be back into effect. I'm assuming they would challenge some component of it. And once it come back into effect, my amendment would not apply. So that person would be able to either come back or not. And this is not something, we have a lot of, federally funded employees at the state and county level. So this is not something new. If I were you, I would argue on the collective bargaining part of this rather than where we're going, because I think that would create a different scenario. However, this is not a new thing. We have federally funded employees in a lot of agencies and in some counties, university. This is not something new. And once that federal funding runs out, that position either has to be funded by the state, by the county, a different grant program, and I would argue it's one of the problems that we have in holding, kind of our system accountable. Not that I'm trying to get at that with this amendment. I am merely just trying to tie the same triggers of conformity if something happens and as Representative Liebling said, the minute that HR compliance is no longer required is the same minute that we, as taxpayers, stop paying for that conformity to occur. That's it.
Representative Pinto.
Thank you, Mr. Speaker. Representative Nadeau, thank you for bringing up. I'm embarrassed not to have thought of the collective bargaining implications, because that's an excellent point. As I'm understanding what you're saying here, provision gets ruled to be not in effect. Somebody loses their job. As you pointed out, then provision comes back in. We bring our state employee back in, back and forth and back. I guess that you do say notwithstanding any law to the contrary, so would be, at that point, I guess, attempting to violate collective bargaining rights. It sounds like a complicated legal pickle that you'll get us all into at that point. I'll note, it seems in significant contrast with the Liebling Amendment, which is talking about a particular requirement under H.R. 1. You're simply saying that if any provision of H.R. 1 is no longer in effect, then potentially somebody loses their job. And interestingly, you're not talking about it being supported, the employment being supported by appropriations in H.R. 1. You're talking about being supported by appropriations in the state bill, in the state law. So I guess given how common it has been with the Trump administration for actions to be found to violate various rights and various laws, I think the scenario I'm describing is quite likely, and I don't think we want to have our state be subject to that additional chaos on top of all the other chaos that we've been subject to. So I would urge a no vote on this. Thank you, Mr. Speaker.
I recognize a member from Hennepin, Representative Lee X.
Thank you, Mr. Speaker. Frankly, to be honest, I am just absolutely appalled. I am appalled at this amendment. Representative Nadeau, we are Senate district mates and we've done some work. Again, I appreciate you bringing me into some of the discussions across this session. But what I just talked about earlier and what our side has been talking about is doing the least amount of harm, reducing the financial and a traumatic impact of H.R. 1. And with this amendment from Representative Liebling, you counter with an amendment that will go right at people's livelihoods. Yes, that happens. In fact, that happened last year when the federal government clawed back health funds that supported state funding, threw us into a time of chaos. Who's going to get fired? Who's going to get put on pause, right? Yes, when the federal government wants their money back, oh yeah, they'll take it back. at the risk and at the detriment to people's livelihoods and community organizations' programs that affect our constituents across the state. MDH in particular went through months of, oh, you're let go. Oh, wait. Oh, you can come back now. Oh, but we have this amount of funding. So you can only come back for this amount of time. Well, y'all over here are let go now. Oh, wait. No. Oh, y'all can come back. Oh, but we're going to phase this in. That's, to Representative Pinto's point, right? So I rise to say, I'm just, appalled. I can't believe this amendment, would be brought to just immediately fire, or let me find the, terminate. Yeah, immediately, DHS must immediately terminate employment of DHS employees whose employment is supported with appropriations, federal money. It's just very harsh, and it does not do the least amount of harm. It adds harm. Thank you.
I recognize a member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker, and thank you, members, for a great discussion here. And lots been said, and I'm not going to repeat it. I just want to say to the maker of the amendment to the amendment that there could have been a way to do this. Clearly, the amendment is, you said yourself, it's not mean-spirited. I don't know why you brought that up. But yeah, if we under the big ugly bill, we're going to be cutting people off health care and growing the bureaucracy a lot. And yes, so people are going to have to be hired. They're going to have to be hired by counties because that's the problem. One of the problems with this work requirement thing is that you spend so much time, effort, and money on the bureaucracy to track it and keep at it and make sure that everybody's complying, that it's waste. It's waste. Maybe we should send our waste bureau after that when it comes into effect. I don't know. So yeah, we're growing agencies under the big ugly bill for sure. There would have been a way to get at this, to reduce that if we are fortunate enough to be able to get away from the hostage takers and not have to continue complying with this big ugly problem. But this bill doesn't do it. This bill targets individual people and just fires them regardless of their union rights, their seniority, and any other considerations like Representative Lee was talking about. So members, please vote red on the amendment to the amendment.
Any further discussion on the amendment to the amendment? I recognize the author of the amendment to the amendment, Representative Nadeau.
Thank you, Mr. Speaker, and thanks for the discussion, members. And I think I started out saying I didn't want it to be, I wasn't intending it to be mean-spirited because I didn't want people to be appalled. I mean, that's not what I'm trying to do. So, members, again, the amendment is pretty simple. It is literally just tying the conformity costs that we have at the agencies to the idea that if we no longer need to federally conform, then we should, the taxpayers, they're the ones that are on the hook for these things, it would also provide relief for them. Members, once again, please vote green.
Seeing no further discussion, the clerk will take the roll on the amendment to the amendment. The clerk will call the names of the members voting remotely.
Baker. Baker. McDonald. McDonald. Momani Hiltsley.
Momani Hiltsley, no.
Momani Hilsley votes no. Schultz.
Nathan.
Vote green.
Schultz.
Schultz.
Schultz. Aye.
Schultz votes aye. Baker.
Go ahead, Dave.
Baker votes aye.
Baker votes aye. McDonald.
Okay, go. Aye.
McDonald, aye.
McDonald votes aye.
The clerk will close the roll. There being 67 yeas and 67 nays, the amendment to the amendment does not prevail. To the underlying amendment. I recognize a member from Wright, Representative Hudson.
Thank you, Mr. Speaker, and thank you, my colleagues on the other side of the aisle, for spending our time and discussion over the Nadeau amendment to the amendment, making the case against the Liebling amendment. Because every problem that you had with the Nadeau amendment applies to the Liebling amendment. We should not condition the enforcement of law under the subjective interpretation by the commissioner of whether or not federal law continues to require its enforcement in order to receive funds. That's a whole lot for one guy to have to try to sort out. There's a reason why we have this legislative process that leads to changes in law. There's a reason why we don't have one person making all the decisions. There's a reason why we need 68 votes in order for something to pass, the reason why we have committee processes, so that we can take the full measure of what any change in circumstances is. Under this, by your own logic, Representative Pinto, you said it's very likely that there could be challenges to H.R. 1 and how it's implemented in court. Well, let's say that happens. Let's say there's some injunction that says that we're not going to enforce a certain part of H.R. 1. Well, according to the way the Liebling Amendment is drafted, apparently that means we can just pull back and not enforce our law. But what happens when the case moves in the other direction? Now the law's back on. Now we got to switch all over again. Sounds like the very chaos that you claim that you're trying to avoid. This is not a very well-crafted, thought-out policy. It certainly provides, we heard what the intent of it is. It was stated by Chair Liebling. The intent is to create a political narrative about where we stand on Washington, D.C. policy. In terms of this piece of legislation, it doesn't function in the way law is supposed to function. It's not crafted to actually work in the real world. So I'll be voting no. I'm sure there'll be a lot of other no votes as well. I appreciate the theater, but the policy doesn't work.
I recognize a member from Traverse, Representative Backer.
Yeah, for several reasons that Representative Hudson said, I would ask members to vote red on this also. Thank you.
I recognize a member from Olmsted, Representative Hicks.
Thank you, Speaker. I want to be really clear about a couple of parts of this amendment that I think we really need to consider. And that is the language around medically fragile and disability. One of the things that I don't think people understand until you're in the position is how long it takes to be certified disabled, to be considered a person with a disability for the purposes of health care. There are only two ways to do that: Social Security and the State Medical Review Team. Social Security, on average, denies over 70% of first applications. And most of those are not because those people are not disabled. Sometimes it is. But a lot of times it's because the doctors didn't send in the forms, or the people didn't have the right documentation about adaptive skills, or whatever. So a lot of folks, to get that certification in Minnesota, use something called the SMRT team. It's a state medical review team. That team has been bombarded for several years now and is now running 8 months. It would take them 8 months with no new referrals to catch up. What the labeling amendment does is call out into law specific conditions that would qualify so people could still maintain health care while they go through that process. And if you've ever had someone in your family who's in the prime of their life and has a stroke and suddenly doesn't have access to health care, you know how difficult that is. If you've ever loved someone who suddenly has a child who has a severe disability and a parent has to leave the workforce to care for that child, you know what that looks like. The labeling amendment, to me, isn't about playing politics or throwing barbs across the aisle. The labeling amendment for me is saying we know that people with disabilities may not have the right stamp and the right piece of paper, but they have a right to health care. I would encourage you all to vote yes. Oh, and I'd like to request a roll call.
Seeing 15 hands, there will be a roll call. I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, Representative Liebling, for this amendment. You know, I've spoken to members on the other side of the aisle, and they have told me they don't support the healthcare portions of H.R. 1. They know their detrimental impacts. They know that H.R. 1 is an assault on American values, slashing massive resources from our Medicaid safety net like never before in its 60-year history. Eliminating the $1 trillion from healthcare that we all need, taking those resources from families and communities to fund those tax breaks, the largest transfer of rural wealth to billionaire elites. I think members would want to stop that as soon as possible. Thank you for the amendment, Chair Liebling.
Any further discussion? I recognize the author of the amendment, the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and member as well. If you don't want to vote for something, you can always find a reason, always. And this is very clear, and it's going to be extremely clear to your constituents. Again, as I said at the beginning, whether you're going along with this because you think it's the right thing and you love what Republicans in Congress are doing to our state, or whether you're just doing it because we have to, because we're being held hostage for about $3 billion or so, and you think that we should do it our way, that we should exert our state sovereignty and decide how our programs should be. Of course, in conformity with, we're never completely independent, because it's true. The federal government, with our tax dollars that we send to Washington, D.C., sends a few of those back for us to provide health care for our people. So it's a very clear vote. Please vote green on the amendment.
Seeing no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Baker votes no.
Baker votes no. McDonald.
McDonald votes no.
McDonald votes no. Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye. Schultz.
Nathan, I can't hear.
Schultz.
Schultz, no.
Schultz votes no.
The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Liebling moves to amend Senate File Number 4612, the third engrossment as amended. The amendment is coded A15.
I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. So I don't expect a different result on this one. This is very similar to the first one that I had. I think it was the A10. And the difference is that this this has an additional provision in it, which I know is not going to make a difference to anybody in this room, but the underlying bill says that if you're kicked off of Medicaid, that you're not eligible for Minnesota Care. And this is just a cruel thing. It doesn't mean anything, that language, because right now, if you're kicked off of Medicaid, you don't unless you're kicked off because your income's too high, you're not eligible for Minnesota Care. So it's just language that's in there for no real reason other than, I would say, meanness. And that's the only difference between this amendment and the other one. And so, because I know the vote will not be any different, Mr. Speaker, I withdraw the amendment.
Representative Liebling withdraws the amendment. There is an amendment at the desk. The chief clerk will report the amendment.
Nadeau moves to amend Senate File Number 4612, the third engrossment as amended. The amendment is coded A9.
I recognize a member from Hennepin, Representative Nadeau.
Thank you, Mr. Speaker, and thank you, members. The A9 amendment is it's an anti-fraud amendment, and it's about managed care. This amendment does three things. It requires DHS to communicate with all MCOs, all managed care organizations, when there's a credible allegation of fraud, when it's suspected, and it's reported to DHS. So that's number one. Number two, it preserves a managed care organization's ability to credential and contract with providers and Medicaid assistance. And number three, it requires the addition of risk corridors to all future managed care contracts. Now, I'm going to go into these a little bit because I think it's important to understand what I'm trying to do. You know, managed care organizations, as much as some of us like them, others don't like them that much, they are, a very important component right now in our healthcare system. And last year, they covered about $18 billion in healthcare claims. $18 billion. That's a lot. That's an important part if you're going to, try to look at how do we reduce fraud? Where can we see? It's at the claims area where we should at least be trying. And so Section 1 of this bill, it requires DHS to communicate. So when a managed care organization, identifies an area where there's possibility of fraud, right now they notify DHS. All this does is require DHS to basically inform the other managed care organizations, because as you know, just because you have coverage in one plan with one provider doesn't mean that people don't go to other places. The second part is the network component. And this is credentialing and contracts. And so MCOs, they perform these tasks to verify their credentials of providers. They perform background checks. They ensure the provider has a track record of providing high quality care. I mean, that's what we all want to make sure of. It's one of the things that we've noticed in the last year or so as some of the challenges we've seen in Minnesota with fraud is that we haven't been as robust as maybe we could be when it's looking at credentials of some of the providers that are stepping up to provide services for some of our residents. And the third section in this bill, members, these are risk corridors. And for those of you that don't do a lot in managed care, it's risk corridors are risk mitigation measures. And so these were first, as far as I understand, these were first put in place during COVID, when all of a sudden, plans were paying they had a lot less claims. And so ultimately DHS was able to claw back some of those unpaid dollars. And so what this does is this basically ensures that Plans can't make too much money, nor can they lose too much money. And currently, all of those managed care contracts right now have this risk corridor put in place. All this does is put it in statute. It basically says they have to be even. You know, one organization can't be treated differently than another. They need to be in there. It needs to be even. It provides that stability, that balance, making sure that plans are not making too much money. And also, if this would have been in place, I think it would have been a significant help in the UCare situation. I'm not saying that it would have stopped it, but it would have been a definite, it would have helped. So with that, that's my amendment. Please vote green. Thank you.
I recognize a member from Dakota, Representative Bierman.
Thank you, Representative Nadeau, for the amendment, and a lot of issues in there that we do need to be delving into more. This language was actually a portion of a bill we heard in committee, and was rejected in committee and needs more work. We should be taking a closer look at the ability or inability of MCOs to detect fraud and whether they are sharing that information. We know they're not sharing it with each other, but they need to be sharing it with the legislature as well. We need sightlines into that. And the MCOs are a bit of a black box, as we learned in committee. We should be passing such policy as this, not on the House floor, but in committee, and I encourage you to bring this back next term. And we need to do some work on it and not have our anti-fraud measures written by the insurance agency. And I request a roll call. Thank you.
Seeing 15 hands, there will be a roll call. Any further discussion? I recognize the member from Traverse, Representative Backer.
Yeah, members, having accountability is not a bad thing. Representative Nadeau holds things accountable. And in committee, Representative Nadeau did a very good job why we need MCOs, why they play an important role in this. So why kick the can down the road? We know Minnesota has a fraud problem. Let's get ahead of it instead of us being on the news again and seeing these type of challenges happen. This is a good bill. It's common sense. Vote green, members.
Any further discussion to the amendment? I recognize the author of the amendment, member from Hennepin, Representative Nadeau.
Thank you, Mr. Speaker, and thank you, members. I just want to be clear, and I think it was just Representative Bierman misspoke. It didn't fail in committee. It was just laid over. And there was a component of the bill that my colleagues, you, weren't happy with, and that's why I didn't bring it in this. And this bill wasn't drafted by the insurance company. It was something where I requested how can someone who's paying $18 billion in claims assist the state in doing all that we can to ensure there's no fraud? That's all. That's all this is. So, members, vote. If you don't want to vote for it, that's fine. It doesn't have any cost on the state. This is something that, you know, that can only help. It can't hurt. It can only help. And so if you don't want to help, then vote no. But I would suggest you vote green. Thank you, members.
Seeing no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Baker votes aye.
Baker votes aye. McDonald.
All right, here you go. Go.
McDonald, yes.
McDonald votes aye. Momani Hiltsley.
Momani Hiltsley, no.
Momani Hiltsley votes no. Schultz.
Schultz, yes.
Schultz votes aye.
The clerk will close the roll. There being 67 yeas and 67 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Backer moves to amend Senate File number 4612, the third engrossment as amended. The amendment is coded A22.
I recognize a member from Travers, Representative Backer.
Thank you, Mr. Speaker. What A22 does is it expands 340B reporting requirements. It's really looking at ways to hold the actors that are involved with 340B accountable, just in case there are fraudulent activities. It also adds greater transparency on revenue use. It requires additional disclosure from the hospitals, and it expands reporting. And then finally, what it does is it creates a statewide 340B study. 340B plays a strong role in our hospitals. I know both sides of the aisle understands that, and it is important that we make sure those dollars are being directed correctly, because at the end of the day, we want to provide the best health care for those who are on medical assistance. So that's a summary of what this amendment does. Thank you, members.
There's an amendment to the amendment at the desk. The Chief Clerk will report the amendment to the
Point
amendment.
of order, Mr. Speaker.
State your point of order.
Mr. Speaker, under 3.21, motions and propositions must be germane. And while I am regretfully making this point of order because we have amendments as well to 340B, 340B is not in the underlying bill, and so this is introducing a new subject. So I ask that you find this A22 not germane.
Advice. Oh boy, we're leaving it to me. I recognize the member from Travers, Representative Backer.
Yeah, my advice would be, Speaker, this is dealing with health care. It plays an important role with our hospitals. And yes, it is germane because we are referring to the health care bill. So I would ask, that is my advice, to not support Representative Long's motion.
All right, members. Well, I have taken the limited advice that was provided, and I have read the rules, I've read the bill, and I have determined that the point of order is well taken.
Mr. Speaker.
Representative Niska.
I appeal the ruling of the Speaker and request a roll call.
Representative Niska appeals the ruling of the Speaker. Are there enough hands? Seeing enough hands, there will be a roll call. Representative Niska.
Vote no.
Oh, boy. All right, members, I'll remind you once more that the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or a green vote supports the ruling of the Speaker. A no or a red vote goes against the ruling of the Speaker. Seeing no further discussion, the clerk will take the roll. Members, please vote. The Chief Clerk will call the names of the members voting remotely.
Baker.
Go ahead, Dave.
Baker votes no.
Baker votes no. McDonald.
McDonald, no.
McDonald votes no. Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley, aye. Schultz.
Schultz, no.
Schultz votes no.
The clerk will close the roll. There being 68 yeas and 66 nays, it is the judgment of the House that the decision of the Speaker shall stand. There's an amendment at the desk. The Chief Clerk will report the amendment.
Zalesnikar moves to amend Senate File 4612, the third engrossment as amended. The amendment is coded A25.
I recognize a member from St. Louis, Representative Zalesnikar.
Thank you, Mr. Speaker and members. This is a simple bill. It extends the sunset on the 340B language by 5 years. I hope you will vote yes. Roll call, please.
Are there 15 hands? There will be a roll call.
Point of order, Mr. Speaker.
Representative Long, what's your point of order?
Well, we just had a vote on this exact topic, and this is also 340B, so I ask that for the same reason as you did on the 822, you do the same on the 825.
Is there any further advice? All right. Well, I guess I'll do the same thing, and the Speaker will find the point of order well taken.
Mr. Speaker, I appeal the ruling of the Speaker and request a roll call.
There are enough hands. There will be a roll call. Representative Niska.
Thank you, Mr. Speaker and members. This is pretty simple. This is uncontroversial, I think. I think everybody pretty much agrees to extending the sunset. Let's overrule, as much as we love the Speaker Pro Tem, let's overrule him and vote no and proceed with this.
Any further discussion? Representative Long?
Please vote with the knowledgeable and wise Speaker.
I'll remember that the question before the body is, shall the decision of the Speaker stand as the judgment of the House? A green or yes vote supports the ruling of the Speaker, and a red or no vote goes against the ruling of the Speaker. Seeing no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Baker.
Go ahead.
Baker, no.
Baker votes no. McDonald.
Go. Joe.
McDonald.
McDonald, no.
McDonald votes no. Momani Hildsley.
Go.
Momanya Hildsley, aye.
Momani Hildsley votes aye. Schultz.
Schultz, no.
Schultz votes no.
The clerk will close the roll. There being 70 yeas and 64 nays, it is the judgment of the House that the decision of the Speaker shall stand. There is an amendment at the desk. The Chief Clerk will report the amendment.
Bierman moves to amend Senate File number 4612, the third engrossment as amended. The amendment is coded A12.
I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Members, the 340B drug pricing program currently in place in Minnesota allows safety net hospitals to receive prescription drugs from pharmaceutical companies at a discounted price. Rural hospitals, if you speak to them, will tell you that this healthcare legislation is critical for them. Doesn't matter if you are from Winona, or Ely, or Bemidji, or Blue Earth, or Brainerd, or Madelia, or Perham, or Crookston. Your hospital will tell you that this legislation to safeguard their funding for the 340B program is critical. Take the example of Virginia Hospital. The Virginia Hospital Administrator recently told the news that his hospital relies on 340B because funds they would otherwise spend on medication expense can go toward another area of their hospital in need. His quote is, "It is the only way we can continue to deliver the care that we deliver in these rural communities." He said that Virginia site alone receives over $20 million in discounts. And ultimately, without it, you would not see the same level of healthcare delivery with that kind of impact on the margins at the Virginia Medical Center. He asks to please pass House File 3609. Pharmaceutical companies will say they only have to offer discounts at one pharmacy per hospital. There has been litigation around this. From this litigation, it is clear that states have the power to pass laws that compel drug makers to offer discounts at every pharmacy associated with the qualified hospital. This is the case in red and blue states. Hence, the state law passed off the Minnesota House Senate floor this term. This bill would compel drug makers to offer discounts at every covered entity pharmacy associated with one of the 340B hospitals. And unlike the current law, it provides enforcement power to see that the drug companies comply. Our hospitals are under extreme pressures right now. Rural hospitals are stretched, and the massive Medicaid cuts enacted by Republicans and President Trump will stretch them even more. Some will close. The 340B program may be the difference for some of them to survive now. Give them a reprieve. Give them just a little bit of solid ground. The solution is very simple. Repeal and enforcement will ensure manufacturers cannot limit the access of discounted drugs to covered entities, as they are doing right now. What our hospitals need is enforcement so that when pharma is violating the law, the hospitals have someone to turn to. Just today, an article in MinPost quoted a quote from a GOP member that said, "The best thing is to have it in the lane of the state attorney general's office." What that member said is true. The AG is the only enforcement body capable of taking on Big Pharma's lawyers. That's what hospitals want to see from us. If you talk to your local hospital, you're going to get the stories that they're keeping obstetrics open, they're helping home health care. They need this funding from 340B. It's critical now more than ever. Vote green. And I request a roll call.
Seeing 15 hands, there will be a roll call.
Point of order, Mr. Speaker.
State your point of order.
Thank you, Mr. Speaker. Under both Rule 3.21 and Rule 4.03, the A12 amendment is out of order. For the very same reasons that you just ruled on the two previous amendments, this is not germane to the bill. It's also out of order because it creates additional costs for the bill.
Advice? Representative Long.
Mr. Speaker, would Representative Niska yield to a question?
He will yield. Representative Long.
Representative Niska, I thought I made a pretty good argument on the A22 and the A25. I'm just curious what has changed since then for the A12.
Representative Niska.
Well, thank you, Representative Long, for that question. I'm curious as to what advice you're going to give the speaker on this. The knowledgeable and wise speaker who ruled on the other amendments. We've had a ruling on this issue now. The other thing that did change is that this introduces a cost element with the Attorney General's Office enforcement. There is a fiscal note on a version of this bill where the Attorney General's Office makes clear they will be coming back to the legislature for cost to deal with this. If the problem is as big as Representative Bierman is claiming it will be a large cost indeed. And so there's Rule 4.03 is implicated on this as well.
It's a good amount of advice. I've studied the amendment. I've reviewed the bill. I've considered the advice that was provided, and I'm ruling that the point of order is well taken. All right, there's an amendment at the desk. The Chief Clerk will report the amendment.
Katiza with 2 and moves to amend Senate File Number 4612, the third engrossment as amended. The amendment is coded A18.
I recognize a member from Hennepin, Representative Katiza Wattoon.
Thank you, Mr. Speaker. Members, because the other body doesn't have a Children and Families Committee, one of the many strange and questionable things they do across the hall, I'm sure that we can all agree on that, the Children and Families Finance and Policy provisions journeyed to conference committee alongside Health and Human Services provisions. We all voted for that last year. If you voted for the health bill last year, you voted for the Children and Families provisions last year. They were merged together in Ways and Means. This year, the provisions were not added on in Ways and Means. And so I am bringing this amendment today so that Children and Families provisions can continue on to conference committee and we can continue doing the work of the children and families of the state of Minnesota. Mr. Speaker, the A18 amendment is a small package of child care, economic support, and child protection and welfare proposals, which include House File 1900 from Representative Nadeau, which updates restrictions in SNAP and MFIP recipients who are formerly convicted of a felony-level drug offense. Then we have what did we call you? The wise and the knowledgeable speaker. We have one of your bills, Mr. Speaker, House File 4316, which would allow child care providers to self-report any licensing violations And then there would be public posting along that would indicate that they self-reported a licensing violation, as well as requiring providers to share written materials on the signs of physical abuse and neglect, as well as display a poster at their center so that parents are better educated as to the signs of potential abuse. Section 7 of the amendment here is House File 4384 from Representative Bakeberg, which would add a requirement that abusive head trauma training, which already exists and is required, that it be interactive. The current training, we have confirmed, already meets this requirement, but this is just another way to ensure that future trainings remain interactive. The child protection and welfare provisions in this bill ensure that some of the most vulnerable Minnesotans, our fosters, get the support that they need. Children in foster care have already experienced traumatic events in their young lives, adverse childhood experiences like surviving violence, abuse, neglect, witnessing violence in their home or in their community, or living in a home with grown-ups who suffer from substance use problems, mental health challenges, or incarceration. And the provisions that we have that deal with foster care are House File 3665 from Representative Pinto. And Mr. Speaker, I'm curious if Representative Pinto would yield.
He will yield. Representative Katiza-Watun.
Thank you, Mr. Speaker. And Representative Pinto, I'm hopeful that you can just share a little bit about your work on House File 3665 and the importance of this bill for our children in foster care.
Representative Pinto.
Thank you, Mr. Speaker. I'll do so quite quickly, members. The provision that Representative Katiza-Watun is referencing, Section 7 of, I think it's Article 6 of the amendment, just addresses a gap, and we have so many of these in our statutes where we treat kids above the age of 5 different than kids below the age of 5. We require out-of-home placement plans in child welfare cases to make sure that kids above the age of 5 have educational stability, and we know that that stability is even more important for young kids, trying to close that gap. That's what the provision does. Thank you, Mr. Speaker. Back to Representative Katiza-Watun.
Representative Katiza-Watun.
Thank you, Mr. Speaker. We also have House File 3714 from Representative Clardy. And Mr. Speaker, I'm hopeful that Representative Clardy would also yield.
She will yield. Representative Katiza-Watun.
Thank you, Mr. Speaker. Representative Clardy, would you just share briefly with us about your work on House File 3714 and the work that it does to help our foster children and foster families?
Yeah, absolutely. So this is a safety net, just like a lot of us use our social capital to navigate the world. A lot of the kids that we're talking about are the most vulnerable kids, so it's to make sure that our students have access to before school care and after school care, which would keep their parents in compliance with state law of not leaving the littles home alone. So, thank you.
Representative Katiza-Watun.
Thank you, Mr. Speaker. And finally, we have House File 3002 from Representative Hicks. Mr. Speaker, I'm curious if Representative Hicks would also yield.
She will, just this once. Representative
Thank you.
Katiza-Watun.
Thank you, Mr. Speaker.
Representative, sorry, back to you.
Representative Hicks, can you give us a little bit of background on House File 3002 and how it helps our foster youth who need extended foster care supports?
Representative Hicks.
Thank you so much for the question. So this ensures that our young adults in foster care who are aging out of the system have an independent living plan, that the county has worked with them to make sure that they qualify for extended foster care, that they aren't just being thrown out into the street and homeless. It also removes discriminatory language that says if you have a disability and some random social worker thinks you can't live alone, you can't qualify for extended foster care and you're not allowed to try. So that's a really big deal because youth with disabilities, particularly those with developmental disabilities from the ages of 18 to 21, participate in these really cool transition programs. If you haven't seen one in your district, I'd encourage you to go. But if they're kicked out of foster care and they're put in a group home, they don't have the opportunity to practice those skills and work towards independence. And it costs you a lot more money.
Representative Katiza-Watun.
Thank you so much, Mr. Chair. Members, two of these foster provisions from Representative Pinto, House File 3665, and Representative Hicks, House File 3002, did not actually pass out of the Children and Families Committee this year because the fiscal notes were delayed. Once we received the no-cost fiscal notes, DFLers were told then that Republicans in the committee would not support a supplementary budget package, including these bills. Republicans delayed these bills and then flat out voted them down. And so last week in Ways and Means, I brought a similar amendment to this. Republicans voted it down again. I have scaled back the amendment today significantly due to cost, because I know we can't change the cost of a bill on the floor. And I am just curious, Mr. Speaker, if my co-chair, Representative West, would yield for a question.
Representative West, will you yield for a question? He will yield. Representative Katiz-Watun.
Thank you, Mr. Speaker.
Representative Katiz-Watun.
Thank you, Mr. Chair. I was just wanting to make sure that I actually do have the floor. There's a lot of noise coming from that back corner. Representative West, we worked together very well last year. We were able to pass a robust budget that supported the Children and Families Committee and children and families all across the state. You know that your bill, you were the chief author of the budget bill last year, got merged into the health bill, and that's how it traveled to conference committee and how we worked together with our Senate companions to move the budget forward. This year we haven't been able to do that, so I'm just curious, what is your intention as we move this into conference committee? How are we going to ensure that the work of the children and families of the state of Minnesota gets done this year?
Representative West.
Thank you, Mr. Speaker, and thank you, Representative Katiz-Watun. We should continue passing bills that went through our committee, which many of these are in Ways and Means or on the floor here, which I believe I would advocate for all of them. And we still have conference committee ahead of us, and anything can happen in conference committee. There are many ways to move forward.
Representative Katiz-Watun.
Thank you, Mr. Chair. Members, I would just highlight the fact that these proposals are non-controversial, they are bipartisan. Most of them, again, have been vetted and didn't have any issue in committee, but for a delayed fiscal note, we all know how frustrating that can be. But I would encourage members to support this provision so that we can continue the work of the Children and Families Committee because of the silliness of the structure of the other body. And I would request a roll call, Mr. Chair.
Seeing more than 15 hands, there will be a roll call.
Point of order, Mr. Speaker.
State your point of order.
Mr. Speaker, the A18 amendment under Rule 3.21 is out of order. It's not germane to this bill. There's no children and families provision in this bill. It doesn't matter if it was, if this would have been germane to a previous bill. It's not that the germaneness is tested on the bill that we have before us. I urge you to find this point of order well taken.
Advice. Representative Katiz-Watun.
Thank you, Mr. Speaker. Advice to you would be, this was always meant to be a children and families bill. This is how we have to structure things in order to move them to conference committee, and the process has been interrupted this year against my urging to move things forward and to work together. We today have the opportunity to stand together and take these provisions to conference committee. Earlier this week, Leader Niska had said that Minnesotans don't care about process. So we've got that, right? Minnesotans don't care about process. Let's take these provisions to conference committee. We can prevent child abuse. We can support our child care providers. We can increase interventions for our fosters, or not. I can tell you that House DFLers will never give up on the children and families of Minnesota. We've heard a lot about this year, and I'm just curious, you can show with your vote, do you even care about children or not?
Members. I really don't like it when you do that. Any further advice? All right, members. Well, I've studied the amendment, I've reviewed the bill, I've considered the advice, and I'm ruling that the point of order is well taken. There are no further amendments at the desk. The Chief Clerk will give the bill its third reading.
Third reading, Senate File Number 4612, as amended.
Third reading. Discussion. I recognize the member from Dakota, Representative Hewitt.
Sorry, Mr. Speaker. I knew I didn't have any more amendments. So today I will be supporting this bill as it has a number of my bills in it, but I can tell you Representative Backer didn't buy my vote. We have to do something, and this is the start. Am I upset about this bill? Yeah, because both sides, and I've had many discussions with my friends across the aisle here about mental health, and it's not in the bill. And we really have to go further because this is where I think we do come to an area that we can agree on, is that we got to figure out how to take care of our mental health issues in the state. I can tell you that from my transport experience, individuals, or from my ER experience, that individuals experiencing a mental health crisis are really at the bottom of the scale as far as how they got to that place that day. They maybe lost their jobs 3 months earlier, which means they lose their insurance, which means they lose their funding, which means sometimes they lose their housing. And sometimes that crisis, as many have heard, take place in really awkward positions, and then an ambulance service is called in to transport them to an ER. Those visits in ERs are extremely expensive. And actually the worst place for you to be in a mental health crisis is an ER, but it's a safety net that we use. Many people that are admitted into an ER for mental health crisis stay there for 6 to 7 days because they can't get placement from anywhere around the state. Mental health, in many cases, if you have insurance, they'll find a bed for you, but if you don't, you're gonna be sitting at one of our safety net hospitals. And we've heard about this over and over this term with what's going on with Hennepin County Medical Center. So as we look at should we vote, should we not, yeah, this is gonna go to conference, and I'm hoping it's gonna come back better, but I am a yes vote today, and I encourage members to really look at their communities and what we need for this. This is the start. And I've talked to both chairs, and I really have faith in where we can go as a House position on this. Thank you, Mr. Speaker.
I recognize a member from Wright, Representative Hudson.
Thank you, Mr. Speaker. I wanted to take the opportunity during third reading on this bill to talk about something that's not in it that I really wish was. And I had been planning to do this since before we started hearing the bill. And I was planning on being pretty nice about it until I spent the last 2 hours listening to a lot of preening and pretense about the value of reducing harm and how you're never going to stop fighting for children and families. Well, let's go back to 2023. In 2023, you made changes to how family residential services work. There are 1,100 small family residential service homes, many of them working out of their own living room, their own houses. They offer 24-hour family-like care to both adults and children with disabilities. These aren't business institutions in the way you would tend to visualize or imagine. These are people who are living as an effective family in their homes, with tenants who are some of the most severely disabled people in our state. I had the opportunity to visit one of these homes in North Branch during the interim and was struck as I sat and listened to their story of how they've engaged in this multi-generational work to care for people who truly are incapable of caring for themselves. We're talking about, in some cases, adults with the cognitive capacity of, say, a 3-year-old. One of the tenants in the home that I visited had the cognitive capacity of an 18-month-old. And as you go through the house, there are modifications that have been made in order to provide appropriate care and services for these folks. And the life of these providers who open up their homes to do this, it's not like any other lifestyle or life experience that you can contemplate. In order to go to the park or go to a movie, you got to take the whole house with you. Sometimes between caregivers and tenants, you're talking about something like 18 people walking into a movie theater in order to watch a movie. It's an excursion. It's a project. But the quality of life for these folks is about to get drastically worse. These providers have been moved from the stable, needs-based DWRS framework to a flat, tiered rate system. Independent modeling shows that rate cuts of 15 to 67% are going to hit a lot of these homes, regardless of the complexity of care that the tenants need or the round-the-clock support that these tenants require. You know, I ask myself, especially in light of the rhetoric we've heard today about how loving and caring you all are over there and how insensitive and inconsiderate and evil we are over here, how does this happen? How does this happen under a Democrat trifecta? You say you want to care for the most vulnerable. These are objectively the most vulnerable. The most. And I also ask myself, why hasn't a fix been advanced this year? There is a bill. Franzen's authored it. There's co-authors on both sides of the aisle. At least one of your members has signed on to this bill. But why isn't there the political will to make it happen? I have a theory. I can't state it for sure. But it's something that I've noticed not just with this situation, but in several other issues that don't get the attention of folks in this building. When you have an issue that affects a group of people that are decentralized, they're spread all across the state, they're not connected to each other, they don't have a lobbyist, they don't have a union, they're not actively involved in the political process because they don't got time for that. They spend 24 hours a day actually caring for the most vulnerable among us. It's really hard for folks like that to get our attention down here. It's not to say they haven't tried. I know I've gotten emails. I suspect you have too. Clearly, legislation has been drafted. Folks on both sides of the aisle have signed on to it. So what's the holdup? I see I've lost the collective interest of the room, just like these folks have lost the collective interest of this institution.
I recognize a member from Ramsey, Representative Gottfried. I recognize the member from Olmsted, Representative Hicks.
Thank you so much, Speaker. And I want to set the record straight. The change in the tiered system for family residential providers did not happen in 2023. It happened in either 2021 or 2019. I don't remember which, but I know because in 2023 I tried to repeal it. Representative Verning tried to repeal it too. But it's been approved by CMS, Trump's CMS, to cut Medicaid funding. The federal government has approved the change in the rates. And once that happens, getting those rates back up is virtually impossible. So I will not sit over here and be told that I don't care about those things when I literally, since I stepped into this building, have been doing nothing but trying to fix disability rates. By the way, with no help from several folks over there. There are several of you who are always helpful. There are several of you, including Representative Franzen, who it is in her heart and she wants to fix it. The problem is nobody wanted to fix it until it was here, until the feds approved it, until we were already out the door. Because until it is right here and people are being hurt, nobody pays any attention. And when we are trying to tell you that this is going to hurt people, like this bill we're voting on today, nobody wants to look at it and talk about it. It's, well, we have to, we don't have a choice, it will do this. I'm telling you, people with disabilities are going to be hurt by the language in this bill that does not outline what is considered disabled. Just like they were hurt before you or I were in this building when that bill passed. Just like they were hurt when no one wanted to have the conversation about kicking that date out. Just like they were hurt when Trump's CMS approved those rates. If you're going to talk about things that are hurting people with disabilities, let's talk about the whole picture, including that this bill makes it so when you suddenly become disabled at the onset of disability, you are not going to have access to health care. And that is H.R. 1. That is the ugly bill. That is true. And today, we are going to vote on that. And we are going to dehumanize people, and you are all going to get calls from people in the next 12 to 24, 36 months, and you can all buy me a cup of coffee when it happens. That they don't know what they're supposed to do because they've been kicked off their employer's COBRA, they can't get through the SMRT process, they're not certified disabled, and they've been waiting 2 years for their Social Security approval. And how are they supposed to get health care? You're all going to get those phone calls, every single one of you. I hope that you remember this conversation.
I recognize a member from Ramsey, Representative Gottfried.
Thank you, Mr. Speaker. You know, this health bill seeks to bring us into alignment with H.R. 1. And as Chair Backer said himself, if we don't do that, we'll lose $3.5 billion annually, as is delineated within H.R. 1 itself. And before we pull a little bit more on that thread, I just want to kind of ground us in what we get for H.R. 1. We get tax cuts for the wealthy, and that goes here in Minnesota. In Minnesota, the richest 1% will get 22% of the benefits of that tax cut. The next richest 4% will get 24% of that benefit. So if we're doing the math, the top 5% of earners in our state get almost half of the benefit of the tax cuts of H.R. 1. The next 15% receive 26 of the benefit of those tax cuts. So in total, the top 20% of earners in our state get 72% of the benefit. And so what do the rest of the 80% of us get? We get roughly 1/3 of the benefit of the top 20%, plus we get to foot the bill for $1 trillion transferred of costs to local and county governments. That's not just made up. That is from the National Association of Counties, a nonpartisan group. And what happens when $1 trillion of costs are transferred to local and county governments? Our property taxes go up. So we get the auspicious honor of footing the bill for billionaire tax cuts, in addition to higher property taxes, in order to align with a bill or lose $3.5 billion per year annually. We foot the billionaire bill and increase strain on our hospitals, specifically our rural hospitals, or we lose $3.5 billion per year. We foot the billionaire bill and dump people in need from Medicaid, or we lose $3.5 billion per year. We foot the billionaire bill and we hurt people with disabilities, or we lose $3.5 billion per year. This is not governance. It's extortion. This is extortion so that we can provide tax breaks to the people that need them the absolute least. And I'm sad to see that so many of my colleagues on the other side of the aisle are joyfully going along with it. Call it for what it is. This is extortion of everyday Minnesotans, harming people who cannot be harmed, who are in the least position to be harmed, to benefit those already at the top. I'm going to vote no on this bill. As many people in this room as possible should vote no on this bill. And I understand that we have to pass it. I understand. But let's not call it anything but what it is, and that is extortion. Thank you, Mr. Speaker.
I I recognize the member from Dakota, Representative Ryer.
Thank you, Mr. Speaker, members. There are not many good things to say about House File 4612. There are a number of features in the bill, and there's a poison pill, the awful Trump bill, H.R. 1, a Republican bill that prides itself on stripping health care from people without regard to the human cost, impact on hospitals, and broader community economic harm, all to deliver tax cuts that enrich the wealthiest among us. Now, before I go deep on this, I do want to recognize improvements to one thing that I've worked on for 5-6 years now, statutes governing physical therapy scope of practice. This was bipartisan work. It was cleanup work. The changes in the bill clarify supervision requirements for physical therapists to oversee student physical therapist assistants and PT assistants. And these are really important, especially as related to the role of telemedicine, ensuring the safety of patients, quality of workforce, education, and training. And we know we don't have enough workforce. But this change pales in comparison to the damage we're forced to inflict on our communities by H.R. 1. There are places where the federal law is very prescriptive and we do it the way it's called for. We have no choice. And there are places where we have, as a state, discretion in how we implement this. And this bill does not take advantage of that to be able to do the least harm to the people in our community, to the providers and the hospitals. The amendments we heard today all addressed the ways that we could have done that. Representative Liebling's amendments, aligning with federal requirements when we need to and not before. And for some items like the cost sharing that Representative XP Lee spoke to about us, we don't need to align until October 1st, 2028. Almost 2.5 years from now. Now think about this. We haven't received guidance from the federal government. We don't know what the requirements will be. And we should not align to standards that will likely change. I mean, think about this administration and Trump's wishy-washy, flip-flop, weak stances. Yes tariffs, no tariffs, big tariffs, small tariffs, ceasefire, not ceasefire, bomb Iran to the Stone Age on Tuesday. No, we're not going to do it for 2 weeks. Ever-changing rationales for his policies. We can't rely on what they'd said so far. So why would we ask our agencies to put plans in place this far in advance? So we have options, and we could take advantage of these options. For requirements with a January 1, 2027 date, we can use our discretion to reduce harm to people, for example, minimizing the look-back period for work requirements. And the item that I'll focus on, the one that was presented by Representative Mahmoud, the retrospective eligibility. So let's talk about the retroactive. Let's talk about the reality of Medicaid eligibility determination. First of all, it's not fast. There are backlogs to get people signed up, in great measure driven by an existing requirement to complete recertifications before processing new applications. That means that if you are getting in line to get health care for the first time, you have to wait for all of the people ahead of you who are getting recertified, and remember, that's going to be twice a year. Second, this bill, the reality, this hurts people who need health care. Maybe you've never been uninsured or had uninsured children, but I've had both. I've lived that. And I still carry that stress and that anxiety and that anger at a system that put me and my family in that position. And we don't have to put more people through that. We have discretion. We can minimize this. And third, this hurts our hospitals. Across Minnesota, hospitals are struggling, uncompensated care is rising, and the need for charity care is exploding. The uninsured rate in Minnesota has already risen, going from a low of 3.7% because of the Affordable Care Act and other policies that we put in place to help people have access to care. We've been leaders of that in Minnesota. We were some of the best in the country. We've gone up 2 full percentage points in the last couple of years as a result of Republican federal policies. Watch it skyrocket with the new Medicaid 6-month recertification rules. DHS estimates that 20% of members, 1 in 5 members, will lose their coverage as a result of the punitive bureaucratic processes. Then watch our hospitals struggle. Hospitals close, nursing homes close, especially in rural Minnesota. And let me tell you how this works then in the real world, what this will look like. So most people don't apply for Medicaid until after hospitalization, but they might have multiple emergency department visits. They might have other doctor visits in the weeks or months leading up to that hospitalization. They may have had a baby or been pregnant before applying for Medicaid. And these services that they've had are expensive. Now, retroactive coverage means that the 3 months going back that we currently allow, those services are going to be covered after you're approved. When you don't cover them, when you cut back that time, it's left as uncompensated care or it's added to patient medical debt. So hear me on this. Without Medicaid coverages, hospitals will not be paid. People in this situation are often living through complicated family dynamics, unstable housing, psychosocial challenges, other barriers. They often need time to resolve these issues before they can complete a Medicaid application. That was my life. Retroactive coverage protects them by covering necessary medical care received during this vulnerable period. H.R. 1 will take away this coverage, and it's going to cause a huge blow to equity and contribute to already shameful health disparities. Now, this sounds bleak, and it is. But maintaining strong retroactive coverage, taking and putting these other amendments in place, as we could do, will at least reduce the financial strain. It'll make the best of a bad situation that our federal government has put us in without regard for the well-being of people. And let's just add that they also now are talking about $1 billion for a ballroom that was going to be paid for without a taxpayer dollar. So tax cuts, ballrooms, wars of choice, that's where the money is going instead of to people. We can help that. We could pass these amendments. We can make changes. We can bring them in conference. So members, I'm going to leave it there. I'm sorry that my GOP colleagues across the aisle wouldn't join us in bringing forward a more patient, provider, and hospital-centered bill. This is a Republican bill. It will be hanging around your necks, riding on your back as you go back to your communities and they see the impact of what you have voted for. And what I'm going to vote for with deep anger, and disappointment, and regret, because as an eternal optimist, anything can happen in conference. Thank you.
I recognize a member from Anoka, Representative West.
Thank you, Mr. Speaker. And just to cover what happened in the Children and Families Committee, we did have, during the budget year, we put together an omnibus bill and passed a budget. Then this year, You know, with the non-requirement for a budget, there was a lot of discussion, and what's been clear repeatedly from our side of the aisle was we want to do single subject bills. We want to pass bills one at a time, the way we should be doing business. So that was the determination as we passed bills out of the committee. We actually didn't have many bills die in the committee. We sent a litany of bills out, bipartisan bills, and they made it through the process, some all the way through already, some are in Ways and Means, some are on the General Register. One of the big priorities that we'd like to see happen this year was getting child care modernization passed, and that was one of our last committee hearings, or the last committee hearing, and that's when we had another discussion of an omnibus bill that was brought up shortly before that. And it made it clear the other side of the aisle didn't want to support a modernization bill without putting a bunch of other stuff in it. So one of the compromises we offered, like, okay, like if that's going to sink modernization committee, we'll send modernization out as our budget bill, but we will also put all these other provisions in a separate bill and we'll pass that out, which that was not supported. So we tried to offer a compromise of getting bills out of our committee for both sides, but in the end, every single bill in that discussion didn't end up making it. However, some of those bills we could still act on, and I would like to see them calendared and act on today. And one frustrating thing about all this debate is just how hyperbolic everything gets. It's one of the reasons why people tune out to politics, because they think, like, well, what you're hearing now, you'd think we're about to enter the apocalypse. But with what we're seeing with H.R. 1, which has been repeatedly invoked as the most horrific thing ever to happen in the history of mankind, SNAP has had work requirements, still does, did before, but somehow over 40 million Americans figured out how to be on SNAP. Work requirements are an expectation. We don't expect people to not work and expect compensation. And the idea that we're going to be like taking the foods out of the mouth of babes. I mean, the number of exemptions, we have pregnant women, people with kids 15 and under, people with disabilities, caretakers of people with disabilities, and even people living in high unemployment areas, all exempt from the work requirements. And again, SNAP has work requirements, yet we see 40 million people around the nation on SNAP. So with these new work requirements, 80 million people are on Medicaid. These work requirements apply to maybe 20 million. And with the current exemptions, around half of those people are expected not to be required to comply. So all in all, we're talking about 9 million people across the whole country. Now you say, oh, that's 9 million people. Well, we're talking about able-bodied adults. If you can work, why do you expect the taxpayer to foot your bills? So the idea that this is going to be some sort of an apocalypse is a complete misrepresentation. People expect people to work to receive compensation. It is not this kind of, we have infinite money that we can just give away to everyone. So I just wanted to kind of bring us back to reality. Things aren't as extreme as people make them seem. And if we would dial it back from the hyperbole, we could accomplish a lot more and honestly bring down the stress level of every single one of us and the people who listen to what we have to say. So I am pleased to see this bill come before us, and I would urge members to support it because we can't lose the federal money, and the other provisions, particularly Representative Ryer's athletic trainers bill, I very much support. So thank you, Mr. Speaker.
I recognize the member from Hennepin, Representative Coulter.
Thank you, Speaker. I'm glad I get to go when I do, because I think, first of all, that I need to clear the record. Representative West said that it was the determination that we would not be passing a package of bills out of the Children and Families Committee. We need to be clear that that determination was made by one person, Representative West. It was a determination that the DFL chair, Representative Katiza-Watoon, did not agree to, that DFL members of the Children and Families Committee were, and if private conversations are to be believed, some Republican members of the committee were not informed of until we were in the room. We need to make that clear. So I am really disappointed that we didn't really get a chance to get into the A18 amendment. It included some really important bipartisan bills to protect kids from abuse, to support our foster kids, to help families use the Minnesota Family Investment Program, which, if you're not familiar, is a remarkable program that helps families save up for big purchases like cars and homes. And all of that work, indeed, almost all of the work of the Children and Families Committee this year is falling by the wayside. And so I'm not going to ask anyone to yield, but my question is, what is the plan to help those Minnesotans? Representative West brought up child care licensing modernization. I am the House author of child care licensing modernization. I want that to happen. And it seems like our Republican colleagues on the Children and Families Committee understand the importance of that happening too. What is the plan to make that happen? I can't tell you how many folks are asking me, what's the plan? And I have to tell them, I don't know. And that's because the work of the Children and Families Committee is not reflected in this bill. And it is just so deeply, deeply disappointing. Not just for Representative Pinto or Representative Hicks or Representative Katiza-Watoon or me, but for our foster kids who used to be called wards of the state because they are all of our kids. For our child care providers who just want to take care of their kiddos. For Minnesota kids and families who need us to step up.
I recognize the member from Meeker, Representative Gilman.
Thank you, Mr. Speaker and members. I'm going to read a quote here today that had a lot of impact on me before I came down to the legislature. It says, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." And this is from Maya Angelou. There's a book, it's titled "Because I Said I Would" by Alex Sheen. And I made a decision coming down to the legislature that I was going to show up with integrity, curiosity, not only care for my district, but just showing up in truth and with a purpose. And this 67-67 tie has been the biggest growth partner for me. Coming in a super minority was the first challenge and hurdle to overcome. But I was able to connect with several members across the aisle, couple senators, people that are in our hallways here, advocates, folks that are going to be impacted by this, whatever legislation we are able to pass out of this body this year. And honestly, sometimes less is more. What I've seen is that I do a worse job spending people's money that they've worked for. And I know that there's a lot of big feelings, but I hope you know that when I've been curious about things and I've stepped in rooms and gotten screamed at, yelled at by members that are really passionate about what's in the bill or not in the bill, what the words say, what they don't say, I keep coming up. I keep showing up in hard meetings going, how can these two bills come together? How can we find peace in the valley and be curious about different perspectives? Our 47th president is our president. They found a lot of things that need a lot of attention. We are here to conform, not only so we don't lose billions of dollars, but I remember sitting in conference committee last year, watching our administration, the Tim Walz administration, literally telling us to cut $1.3 billion from our budget on the backs of those most vulnerable in Minnesota. He propped up all of his folks, he propped up all of his departments. And again, I'm not going to take offense to hearing something needs to be hung around my neck, but that is offensive. We have personal responsibility to show up here, be curious, not take things too personal, because I've heard from one of my members here when I first came in, we aren't special people. And I do have a couple imaginary 2x4s around this place because I want my head to be able to fit through that door. Meaning, my ego does not need to get in the way of doing good things. This bill may not be perfect. It doesn't need to be perfect. We're not perfect. But I'm imploring you all to just consider writing down on a piece of blank paper, because I said I would, and make one commitment before we get out of session. If that means there's a representative on this side of the aisle that you've never said hi to, or smiled to them, or said something to them, try it. Figure out one thing that you have in common. I did that with Representative Cha when I first came in. I found out who rode motorcycles here. Because it brings me joy. And there's a lot of people in this body that did not like the idea of lane filtering and lane splitting. But we were able to get that one over and signed into law in Minnesota because I was curious and people were respectful to me. I don't want to belabor this point, but I care about this body and this institution. I'm grateful that we were able to work on scope bills. I'm grateful for people that have challenged me to understand why are you putting this in this section of law? I mean, there's things that have been hard. I've left messages for people. They haven't called me back. It's all right. Don't call me back. I can see you. I will find you if we really want to have these conversations again. But when we work together and show up, we're showing up not only for our districts, but we're showing up for each other. We're sacrificing our time. And I appreciate that we can put aside some of our differences here, but really care about being compassionate for one another. So I'd encourage a green vote. Thank you.
I recognize a member from Hennepin, Representative Nadeau.
Thank you, Mr. Speaker, and members. Thank you for the debate and discussion on this bill today. You know, I'm with most of you. I think everyone here, struggles with, the things that the federal government does. I know I do. Maybe I should just speak for myself. I struggle oftentimes with what the federal government does. And there's a lot of things that I disagree with. But I'll tell you what, without conformity, and thank you for all who are willing to, work to pass this bill. The federal CMS would be able to deny our waivers. They could withhold state plan amendment updates. They could defer, federal matching funds. They could require us to make corrective action orders, and we're under one of those right now. And if we comply, and when I originally drafted the legislation, I really tried to go right down the middle. There was some ranges that we could deal with, and there were some things that we couldn't. The exemptions. There really isn't any room for exemptions. And also, to be totally honest, there's a lot of guidance that the federal government didn't provide us, and so that will still be coming. And I hope that we have good enough relationships where we can we kind of look at these things and say, yeah, this is tough. All right, but here's what we need to do to try to make sure that our system is as sound as it possibly can be. You know, and the changes that they put in place, I just want to remind, I just want to remind everyone, you know, the work requirements. And I know that there's a lot of issues around that. And I'll be the first one that would say that we might end up spending more money than we actually collect when we're dealing with, you know, some of the cost sharing components that are a requirement. They don't go into effect until 2028. We're doing them today because let's do all those things that we need to do, so as other things come up, now we can maybe move a little quicker. But the work requirements are pretty minimal. And again, remember that these are for working age adults without children. It's the expansion population. That's what it is. And there's a lot of exemptions. There's medical frailty, and Representative Liebling and I are going to continue to talk about how do we define that, and is there better ways that we can do it? No one wants to limit healthcare access to people with disabilities or people who are medically frail. No one does. No one does. So we need to do that. But the work requirements for the people that can, remember, too much for some of us? You know, remember that the work requirements are 80 hours at federal minimum wage. That's $7.25. I'm not here to defend what the federal government did. I'm just stating what it is. It's $7.25. We're talking $580. Or you volunteer for 80 hours a month. And the way we have it drafted, it's 45 days, all right, every 6 months. Every 6 months. And many of you, I'm sure, here know what it costs for annual premiums for somebody on Medicaid, what the per member per month capitation rate is. I'm not going to go into it. Minnesota has superior benefits to almost any other state. Almost any other state, members. So, you know, we should be, in my opinion, we should be focusing on what are our opportunities. You know, how do we kind of grab this and say, how do we do a better job of determining eligibility? You know, is there a way that we can invest, we can apply, and do a better job at making sure that we don't have those error rates? I mean, one of the things that wasn't in, you know, that's not in this bill that we're dealing with is the error rates. That didn't come out of children, youth, and families. The error rates that we're going to withstand in Minnesota are significant. The governor has them in the budget at about $91 million. It's just an error rate, folks. That's not helping anybody. It's just a penalty. So I think we should be focusing on together, hopefully together. We say, okay, here's a situation we have, and how can we use this as an opportunity so that in the future, you know, we have a more stable system. We have a more automated system. We have less error rates because, as we know, the less error rates, the more money we have going to the people that actually deserve it. And that's not a bad thing. That's a really good thing. I want to thank you. I want to recommend, of course, voting green. But I just want to thank you all for the discussion that we had. I want to thank you all for, especially the people in the Health Committee that kind of tolerated me as we went through this process. It was hard, and I think we still have some very difficult work to do moving ahead. And hopefully we're going to be able to, you know, to do that. So thank you, Mr. Speaker. Vote green.
I recognize a member from Traverse, Representative Backer.
Thank you, members. You know, we have these robust discussions because we care about our constituents. And I understand that. We care about their well-being and so forth. But I do want to just talk about one thing. One of the reasons, let's talk about disability individuals. We heard earlier that these people will be possibly be taken off Medicaid. This is one of the reasons why we have the FTEs, so they can go through the applications and so forth to make sure the people are being properly looked at and properly categorized. So that's one of the reasons why we did the FTEs, to handle that. Also, if we look at the requirements for able bodies, and even individuals who have a slight disability, they can volunteer. We're counting, in this bill, it counts if you volunteer, nonprofits, or, of course, work requirements. And as Representative Nadeau talked about, we are not talking about a lot. We're talking about work at least part-time or 80 hours per month. We heard a lot of things here about the people with high income earners. I just want to remind people in HR 1, it focuses only on the work requirements. We're not all of HR 1 bill that was passed from Congress and signed into law last year on July 4th. You know, this bill is about values. That's really what it's about. It is good to have individuals work. It is good to have a strong work ethic. It is good for individuals to volunteer. It is good for individuals to be involved with nonprofits. It's good for individuals to be responsible, contribute to our society in a responsible way. And that's what HR 1 does on the work requirements, because that's what this bill requires. I get it. Some people will disagree with it. But when you look at the policy, it is very fair and it's reasonable. We are not going to have people who are not able to work, force them to work. That's not what this bill does. You know, if you look at Minnesota, we have a very generous welfare system. We have SNAP, we have different other programs, MFIP, CCAP. So we want to help people. At the end of the day, we want people also to feel good about themselves with the work requirements. And that's really what this bill is about. It's our values that says, if you can work, you should work. We're not going to make anybody force or volunteer or with nonprofits. So members, I appreciate the care that we have heard tonight. I do want to set some records straight, and I thank you for your comments. I'm asking for a green vote. Thank you, members. And I do appreciate everybody that's voting green tonight on this vote. I know some of those votes are going to be hard. Some of them will not be as hard, but I want to say sincerely thank you for your support so we can continue to have this discussion and continue to make Minnesota better. Thank you, Mr. Speaker.
I recognize the author of the bill, the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, members. Members, I just wanted to speak a little bit about reflecting on the work of the Health Committee and what it has done in the years some high points in the years I've been in the legislature. 2019, we established the Opioid Epidemic Response Advisory Council, which Chair Baker, unfortunately, is not here, but he and I both sit on that to fight the crisis of opioid addiction in our state. That was an important and life-saving bill. In 2020, we passed the Alex Smith Insulin Affordability Act. We made a commitment to Minnesotans that we won't let them choose between rationing medication they need to survive and putting food on the table. 21, Chair Liebling established a directed payment program for Hennepin Health, a crucial lifeline that has kept a crucial statewide asset afloat to this point. That bill has undoubtedly saved many lives and been essential to the public health of the state. In 2023, we passed the transformative health budget that gave a shot in the arm to our state's EMS system, built out our healthcare workforce, invested in mental health care, and enacted critical protections for those seeking reproductive care. Just last year, Despite all our differences, we passed a health budget that made significant investments in local pharmacies, community health centers, and EMS services. I'm very proud of all that work. And I'm sorry to say that we've lost that forward momentum. We're now in a position where each day fewer and fewer Minnesotans have health care coverage, where more and more clinics and hospitals are on the brink. There are growing swaths of this state where people simply cannot receive the health services they need and have nowhere left to turn. Nothing has done more to reverse our progress in improving health care than the actions of the President and Republicans in Congress last summer when they passed H.R. 1. With the passage of that bill, they kicked over 140,000 Minnesotans off their coverage. They ended the financing mechanisms that kept our hospital system alive, including a $1 billion a year directed payment program that our committee established last year. Rep. Nadeau carried that bill. Chair Backer and I were both on it. Vice Chair Ryer and many of you were co-authors. What's particularly nauseating to me is that the Republicans in Congress are forcing states to do their dirty work for them, align with these new requirements, which do nothing to improve health outcomes, are incredibly costly to implement, and will absolutely cause clinics and hospitals to shutter or risk losing the federal funding that we receive for our own Medicaid program. We are now required to kick victims of human trafficking or spousal violence off our Medicaid program. We're required to implement work requirements, which we know from every single state that has ever tried them will not lead to any more people working and only create more paperwork for enrollees, the counties, and the state to process, and will cause people who are eligible for these programs to fall off because of bureaucratic hurdles. And who's asking for this? It's not my constituents. I doubt it's any of yours. All of this, just so, I'll say it again, to provide trillion in tax cuts to wealthy donors, not regular Minnesotans. The only reason I'm carrying this bill is because I'm unwilling to risk further damage to our Medicaid program from a vindictive administration bent on worsening the lives of Minnesotans who need care. We will not do this because it is a good thing for our constituents, which is what we all came up here to do, but because we're forced to. That said, this could be a very different budget. It could do so much more to mitigate the fallout from H.R. 1, to address the mental health crisis in Minnesota, to continue our work to fight addiction, to keep hospitals open, and respond to the care deserts that we are seeing across this state. It's very disappointing to me that because we are tied 67-67 in this chamber, none of those crucial pieces exist in this bill. Sure, it insulates us from further retaliation if we pass it, but I'm pleading with the members of this body to think about where our healthcare system is headed. Every one of us knows that fewer and fewer people can afford the care they need if there's a clinic open within driving distance. When constituents describe the healthcare challenges they face, they will not be able to point to the House budget as having moved us forward. H.R. 1 takes us in the exact opposite direction. As I reflect on this further, I can't help but wonder in frustration, how long will we continue to be the outlier among major countries of the world where we allow middlemen to interfere in every aspect of our health care, delivery at the expense of patients and doctors that serve them? How long before we recognize, as people across the world do, that it is a far better use of our resources and produces better outcomes when we ensure people have access to preventative care rather than waiting until they show up in an emergency room? How long will we wait for real systemic change to a broken system? The answer, as this health budget makes clear, is at least another session. Future legislatures will not think of the 2026 budget when they think about accomplishments of this health committee in this House. And as co-chair, I deeply regret that. I'm hopeful we can do better in conference. But for now, Mr. Speaker, I ask members to vote their conscience on this one. Thank you.
Seeing no further discussion, the clerk will take the roll. Members, please vote. The chief clerk will call the names of the members voting remotely.
Baker.
Go ahead, Dave.
Baker, aye.
Baker votes aye. McDonald.
All right, bye.
Thank you.
McDonald, I.
McDonald votes aye. Momani Hiltzley.
Momanya Hiltzley, no.
Momani Hiltzley votes no. Schultz.
Schultz, aye.
Schultz votes aye.
The clerk will close the roll. There being 69 yeas and 63 nays, the bill is passed as amended and its title agreed to.